طب ليه ما حدا مركز؟
هذه بلاد والحمد لله تنعم بهذا العمران الروحي الداخلي بنفس الإنسان.
نحن مرآة التغيير، لسنا نقفز نحن نطير، نسبق أنفسنا بكثير وما زلنا نتقدم. نحن مرآة التغيير، لسنا نقفز نحن نطير، نسبق أنفسنا بكثير وما زلنا نتقدم. نحن مرآة المستقبل، نكمل نبني نعطي نعمل، نستقبل نسختنا الأجمل وما زلنا نتقدم. نحن مرآة المستقبل، نكمل نبني نعطي نعمل، نستقبل نسختنا الأجمل وما زلنا نتقدم.
Today, I stand here among you all in my greatness.
I own my light, I own my brilliance.
I'm bold, I'm resilient, I'm devoted,
I cry,
but I'm courageous,
I make mistakes,
but I'm intelligent,
I face challenges.
but I'm persistent.
You will have to become someone you have never been before.
You're going to do something you have never done before.
Because you are a nurse and this is your time.
I wake up with the oath in my mind.
أقسم بالله العظيم.
I come with the intention to do a great job. Nursing is code red for humanity. A team of teams. Share the pain. Share the joy. Love is at the heart of my job. Once upon a time, are we ever too old to hear a story? I was there for her. We bring something to work every day. We sacrifice something at work every day, thousands of miles away from home. We look through each other's eyes. It's impossible to tell where patient hand ended and my hand began. Nursing exists at that space, helping him get on his feet again, celebrating his last chemo. We strip away all the diversity layers. I learn, I defeat assumptions. We weave around the world, caring for patients in every setting you can imagine. I'm a nurse, and that is what we do.
What a heartwarming video. This is our first time as well seeing this video with you. So I want to grab the opportunity to thank all the nurses that participated in this shooting and to thank our marketing team for this amazing job. Thank you. So let's get started.
Good morning, ladies and gentlemen. Welcome to the first International Nursing Conference in Al-Ahsa. We're very glad, very honored to be the masters of ceremony for this event. Get ready to have your socks knocked off by the most brilliant minds in nursing today.
Today's conference is an opportunity for us all to meet, to learn, to hear from the expertise in our major, to connect with colleagues all over the world, and to interact in a lot of workshops.
I'm confident that the knowledge and insights gained from this conference will empower us to continue providing the highest quality of care to our patients. So let's get ready to rock this conference. It is the moment to honor all nurses who have gone above and beyond the call of duty. It is the time to honor all the nurses who have touched the lives of their patients.
So I will start by introducing our first nurse who gone above and beyond the call of duty, my colleague, Ms. Fatima Al-Ghaith. Ms. Fatima is a bachelor degree holder from King Faisal University 2018. She is an ICU nurse, a member in the American Association of Critical Care Nurses, and the Deputy of Critical Care Postgraduate Diploma in Almoosa. Fatima
من جوع فليعبدوا رب هذا البيت الذي أطعمهم من جوع الذي أطعمهم من جوع وآمنهم من خوف صدق الله العظيم.
شكرا. And now, let's start by sharing with you the highlight of the day. You can find it in front of you on the table, the agenda, or you have to scan the barcode placed on the back to see the agenda. Okay, we have to shed the light today on two important panels. First, the nursing excellence, and second, the nursing leadership. And for those who did not register yet for the workshop and the tour in the hospital, the barcode is presented on the main entrance.
In between, we are going to proudly open the Innovation Hub and officially sign the Memorandum of Understanding between Almoosa Specialist Hospital and the Saudi Nurses Association, led by our CNO, Ms. Hera Tashijian, and Dr. Muhammad Al-Ghamdi, the President of Saudi Nurses Association.
Nevertheless, we are going to open the Innovation Hub, which will be placed there, to impress you with our new technologies, with our simulation panel, with posters, booths, and so many things else.
Now, we are very pleased to invite to the stage our strong woman, our rights defender, our nursing idol, the voice of ASH nurses, Ms. Hera Tashijian.
Okay. Good morning, everyone. On behalf of the nursing community at Almoosa Specialist Hospital, it is my pleasure to extend a warm welcome to you all as we gather here today for our first Nursing International Conference on the beautiful soils of Al-Ahsa. As we embark on this journey together, I invite you to open your minds and your hearts to the wealth of knowledge and inspiration that will be shared by our exceptional group of speakers and moderators. This is a time to reflect on the lessons of the past and challenges and turbulences of the present, and to learn from one another as we strive towards a brighter future for nursing. Today, we will be dedicating a morning of rich discussion on the topic of nursing excellence through the lens of the Magnet Recognition Program. As you may know, we have submitted our Magnet document back in October, and we are eagerly waiting for our best next news, fingers crossed. In the afternoon, we will delve into our role as nurse leaders in elevating the nursing profession in the kingdom and around the world. And in the evening, we will be co-hosting a Nurse Leaders Summit with our wonderful collaborators, the Saudi Nurses Association. On our second day, we will be treated to a host of exciting talks on nursing education, research, and outcomes. And let's not forget that we will be celebrating meaningful recognition through the symbol of nurse recognition, the Daisy Foundation, in a Daisy breakfast tomorrow morning. As our theme this year is inspiring nursing excellence and innovation, we would like to invite you to visit and enjoy our Innovation Hub next door, where we have put together a simulation center and booths related to the technology used in our newly opened North Tower. You will see how this technology has enabled us to take care of our patients in a better, more efficient, and outcome-based manner. This hospital has a story, and if you haven't heard it yet, I would like you to meet and chat with our heroine of the story, Miss Sarah Almoosa, right here. She is a voracious storyteller and a social media star, so be prepared to be interviewed and questioned relentlessly. I would like to take a moment to make a few dedications. This conference is dedicated to this man who brought Almoosa nursing to life, Sheikh Abdulaziz Abu Muhammad, as we call him. He passed on this torch to this man, Mr. Malik Almoosa, who infused nursing with vision, growth, and excellence. He comes with his family of extraordinary people who have, day in and day out, demonstrated that nursing in this hospital is a powerful engine of operations, knowledge, and compassion. Without you, we literally would not be here. We thank you endlessly for this. And finally, this conference is a dedication to the wonderful profession we call nursing. I may be very biased, but I firmly believe that we have the best profession in the world. Let us make these 2 days a celebration of nursing. So I welcome you all once again and wish you an enjoyable conference. Let's make the most of this opportunity to learn, grow, and inspire one another as we strive towards excellence in nursing. Thank you.
Ms. Hera.
Please do not leave the stage. Yeah. And now I'm honored to introduce to you my beloved CNO. So, Ms. Hera Tashijian is the Chief Nursing Officer at Almoosa Specialist Hospital. She is a bachelor's and master's holder in nursing from Duke University in North Carolina. She currently is pursuing her PhD studies at King's College London, studying the long-term outcomes of ICU survivors. She is a board-certified nurse executive. She is also certified provider for patient-reported outcome measures in the value-based healthcare community. She has led and served in many regional and international groups and conferences. She is an advocate and mentor for mindful, authentic, and compassionate leadership. And we are so proud to work with you. Ms. Hera will lead our first panel about nursing excellence.
Okay, so we start with our first panel. Our first panel is dedicated to nursing excellence. We have a group of amazing speakers to be speaking at this panel, and I will be your moderator. So I'm still staying on stage. You'll have to bear with me. I'm going to introduce our first speaker, who is Dr. Maureen Lal. Maureen of, yes, you can stand up, Maureen. Thank you. Maureen and I, we've known each other for a few years. Sherry, Alik, what do we call her? She's the queen of magnet. And just yesterday, I found out that we share something else together. We've both gone to the same school. We're fellow Dukies. So exciting to have you here, Maureen. Maureen has held a variety of leadership positions. She's a graduate of Masters at Johns Hopkins Hospital and a DMP focusing on executive leadership from Duke University. She has been with ANCC for over 12 years, and she has been the Magnet Program Director since 2019. It is our honor, our privilege, and our pleasure to have you here, Maureen. We're so excited to have you here. You're gonna add so much value to our discussion on nursing excellence. Please have the stage.
Well, I just want to say thank you so much for having me here today. It is truly my honor and privilege to be able to speak with all of you today. Very excited to be here and really talking about how Magnet provides a framework for nursing excellence. I'm going to start with talking about Magnet and where we fit within the American Nurses Association enterprise. So when we look at a healthy world through the power of nursing, that is the message of what we call ANA Enterprise, which is comprised of the ANA, which is a membership that does a lot of work on policies and really looking at how to raise the bar for nursing. Then we have the foundation. The foundation does a lot of work with, you might be familiar with, end nurse abuse. For nursing violence, you might be familiar with some of the grants that they provide. They do quite a bit of work in promoting nursing and really looking at research specific to nursing care. And then, of course, the American Nurses Credentialing Center, which is where Magnet sits. And you will also be hearing from Dr. Sherry Cosme later, and she is also part of the ANCC, her program. So some little signs you might be familiar with. You saw one just a few moments ago. The round one indicates that you are on the official journey to Magnet. And what that means is you have applied or you're part of our pre-intent program, but you've truly made a commitment to nursing excellence. And then the one below it is when you have achieved nursing. So when you see the one below it, you know that they are a Magnet hospital. Then we have our Pathway to Excellence program, our accreditation program, which includes continuing education, and the practice transition program that Cherry represents. And then, of course, we have our individual certification program. So what does that mean? When you look at all of these programs together, and this is why I like to start with this, is it means that they are all interconnected. Each one of these programs leverages the other program, and when you look at all of these, how they interact to truly create that culture of nursing excellence. So when you think about all of them, you're fostering interprofessional collaboration, you're advancing professional practice, you're having a sustained culture of excellence, because it's important to note that all of the credentialing programs, including Magnet, or I should say I'm a little biased, especially Magnet, has a sustained culture of excellence. This is not one and done. You don't receive the recognition and say, okay, we're all set. What it means is this is ongoing work. You always look for that higher bar to achieve. And of course, when we talk about all of our programs, we are absolutely talking about engagement, making sure that nurses have a voice. Ooh, sorry. Okay, now what about Magnet itself? I'm not going to talk about the history too much because I know Dr. Kwan is going to speak to that in a little bit. But I do think it's important to note that all of the things with Magnet are evidence-based. Everything starts way back in 1983 with a little study, as Maggie McClure says, that really just took off, and people really saw that these are foundational to nursing excellence. If you have these 14 forces, as they called them, in place, you are going to have a culture that supports nursing. Then in 2007, the Commission on Magnet looked again. Hey, let's see if these are still true. Let's see if there is still meaning behind those 14 forces. And not surprisingly, the answer was absolutely. Those are still foundational. But what they did do was take the 14 forces and encompass them within the component as we see it today, the magnet model, that has a component of structural empowerment, exemplary professional practice, new knowledge and innovation, and transformational leadership. In 2020, the Commission on Magnet really took a look again at the mission and vision of Magnet and said, we have really moved beyond the previous one. We are truly a global program, and we need to be thinking about how to promote nursing and health beyond the U.S. walls, because we already were well enculturated in many organizations across the world. So as you can see here, and I won't read it for you, I know that you will be able to take a look at this, but it's truly about that collaboration. It's about nursing excellence. It's about the world vision. It's also about not only the patient, but the community in which they live. I'm going to pause for just a moment. And then when we look at Magnet, and we think about what it truly means, and again, what it does, Magnet does not tell you how to do things. Oh, okay. What Magnet does is it does not tell you how to do things. What it does is tell you what you should have in place to have a culture of nursing excellence. So we like to say it provides a roadmap. It gives you the directions. We don't say to you how to do your shared governance. We say we know successful nursing organizations have a shared governance, and this is what you should have in place. And again, what that means, I don't know what I just did. There we go. So what that means is you are truly looking at the culture that Magnet brings by having the items that Magnet requires in place, but how you put them in place is up to your organization. It is up to how you choose to develop that culture within your facility. Okay, yesterday we had the privilege of doing a tour of the Almoosa Hospital. And I have to say, it was an incredibly impressive tour. The nurses, their enthusiasm, the energy was so important. And when we look, or so evident, and when we look at some of the key fundamental, foundational elements of Magnet, then we can see how they are being lived. When we think about the access to leaders, one thing that really impresses me when I visit a hospital, and I saw it yesterday, is that everyone knows their chief nurse. Everyone can feel comfortable coming up and talking to them and joking with them. Olik was joking with everybody about the Magnet and what they ask for and how they get things, and putting it in context of Magnet. And it's so true. You have access to your leaders, and you are comfortable approaching them. You're comfortable speaking with them. They are available to you. And it's not just about saying, oh, we get feedback. We ask the nurses what they thought. It's listening to the nurses and what their input was, and then incorporating it into the culture. Mentoring. So many nurses yesterday told us their stories of being mentored. Autonomy, being able to work at the top of your license, being able to make decisions about the care that you're providing, being able to have a voice and being comfortable that you have that voice and can speak for your practice. Interprofessional collaboration. Foundational. Nursing does not exist in a void. It has to be part of an entire team. You have to be able to work and interact with those team members and truly find what is happening for that patient to really have successful outcomes. Nursing research. a huge part of Magnet. And why is that a big part of Magnet? Why does Magnet say that you should have research happening in your organization? Because you should be part of raising the bar for nursing. You should be finding that evidence yourselves. You should be incorporating and really living that piece of very critical knowledge that you're developing within your organization. Innovation, that's all part of the working with nursing research, and then peer feedback. I know that sometimes peer feedback, mentoring, transitioning feels a little bit like, well, what does that really look like? Peer feedback, why is it important? Well, peer feedback gives you that look at your blind spots. We all have blind spots, every single one of us. And we can't be aware of them because they are blind spots. But when somebody says to us, hey, you know, when this happens and you could do this better, when you have those crucial conversations, it goes so far. Now, yesterday we had the privilege of meeting so many nurses, and I just want to do a call out. If you are part of the shared governance, can you please stand up? Is anybody here part of shared governance? Okay. So if you keep standing, now tell us who is involved in nursing research here. I heard that there's multiple studies happening. Just the same people? Anyone else involved? Okay. Yep, a few more people standing. And who has either had a mentor or worked as a mentor for someone? Excellent. Everybody, exactly. So if you are a clinical nurse, please stand up. Because you are what Magnet is all about. It is about the clinical nurse. So I'm going to just give you a little round of applause and thank you for the work that you do. I know there were more of you than that stood up. I just want to say that. So, one of the things that sets Magnet apart from other credentials, from other organizations, is the fact that we really look at that evidence-based practice that has empirical outcomes. It's not just enough to have a structure and process in place, although in order to get the right outcomes, you must have that structure and process in place. But how do you know it? You know it by having measurement. And when you measure and you see whether there is an impact from the work that you have been doing, that is an empirical outcome. That is how you know that you are improving your culture in your organization. So a critical piece is the empirical outcomes for Magnet. And to do that, again, we always refer to the Donabedian model because it's such an important part of what we do throughout ANCC. Every single program in ANCC refers to and talks about the Donabedian structure, model of quality, because it is so important to the work that nurses do. You have to have the right structure in place. The right structure leads to the right process. And then if you have the right process in place, you will get the so what. Why are you doing this work? It is for that outcome. Whether it is for your nurses, whether it is for your patients, and how tied they are cannot be understated. And this is some, again, evidence-based results that we know Magnet provides. We know that it causes increased nurse retention and lower nurse burnout. How does it do that? Because you are engaged, because you have a voice, because you can talk to your leaders, because you are heard by your leaders. That you have a decrease in that turnover rate, in your vacancy rate, because it's easier to bring nurses in when they know that there is a culture of excellence. The cost, the amount of money organizations start, and it's always important to talk about cost saving, because where does that money go when you save costs on not losing nurses? It goes back to the patients, it goes back to the nurses, so that you can have more things available. And then, of course, increased patient satisfaction. It's all tied. When you look at when your nurses are engaged, we know that their patients get better care and the patients are more willing to say, oh, you know what, I need to get up and use the restroom. I have this need, I'm having pain, whatever their issue is. If they have a good nurse who is listening to them, patients are more comfortable to say what they need, so that improves their experience. But the reason patient experience matters so much is because it translates to improved patient outcomes, and that is what we're all here for. Then, of course, all that translates to an improvement in those outcomes, in decreased morbidity, increased satisfaction, decrease in the average length of stay, decrease in falls. I was hearing about some falls initiatives yesterday, some amazing data on CAUTI and CLABSI that was truly remarkable, on people having 0 for a year. That's fabulous work. So, again, and this is, I cannot emphasize this enough. The importance of Magnet is this is not a snapshot in time. Number one, you do not do things for Magnet. You do things because it is the right thing to do for your patients, for your coworkers, for the culture of your organization. It is not for Magnet. It is for you. Number two, it is an ongoing process. This is never going to be something that you are done with. This is always about looking at that next horizon, looking at what's next to do, and how are you going to achieve it and move there. It's so important to always be looking ahead. And last but not least, I came across this statement from Vince Lombardi, who, for people who are familiar with American football, might be familiar with the name Vince Lombardi. He was quite a character, I will just say that, and quite well known in the U.S. But again, this misperception of Magnet is it's about perfection. That is not true. Perfection is not attainable. What is attainable is excellence. And you always are chasing perfection. You're always chasing that next level of excellence, and how important that is. But that is what Magnet is. That is why the framework of Magnet matters, because it's always about shooting for that higher level of excellence and achieving it. So, that is all that I have for today. I hope you enjoyed my presentation, and I hope I stayed within my 15 minutes. Okay. But please do not hesitate to reach out and shoot me an email. I love hearing from you. Also, I know several people have reached out and on my LinkedIn, and please feel free to do that. You'll see me on LinkedIn, whichever place. I'd love to hear from you, and thank you so much for having me today. Thank you, Dara.
Thank you, Maureen, so much for kicking us on our first panel discussion. Thank you very much. We will be having a panel discussion on this stage at the end of the series of sessions. So, there are standing mics in the middle of the hallway, across the hallway. So when we come to our panel discussion and questions and answers, if you have any questions, please come forward and ask the speakers your questions. I will be introducing our second speaker, Dr. Jeanette Erickson. Unfortunately, Jeanette, she couldn't be here. But she is going to be presenting through a recorded session. I think she is live with us. Is she live with us? No, not yet. Okay, it's I think around like 1:30 a.m. in the morning. She texted you? Okay, she should be here. Great. I'm gonna go ahead and introduce Jeanette Erickson. She is the Chief Nurse Emerita and holds the distinguished Paul M. Erickson Chair in Nursing of Massachusetts General Hospital. She is an instructor at Harvard Medical School and a professor at the Massachusetts General Hospital Institute of Health Professions. She has authored several books, book chapters, and articles, including her research on the importance of professional practice environment. She has presented globally and consults on multiple issues affecting nurse autonomy, leadership development, and collaborative decision-making. Since 2008, she has been the lead nurse consultant for the strategic collaboration in the creation of Zhihai International Hospital in China's Shanghai province. She is the past chairperson of the Commission on Magnet Recognition, and that's how we know her. She is a fellow in the American Academy of Nursing. She was named a living legend by the American Academy of Nursing in 2002. She also serves as a chairperson of the Board of Trustees for the MGH Institute of Health Professions. I'm very glad to introduce Dr. Jeanette Erickson, and we will be listening to her recording.
Good morning, colleagues. I'm so happy to be able to join you today, even though quite a few miles away. But I'm looking forward to our conversation about professional governance, especially the path forward. I'm hoping that through this session, we will be able to review the benefits and the principles of what I call shared decision-making. We will be able to describe the structures for decision-making, collaborative decision-making, and we will be able to discuss opportunities for the future. I think it's incredibly important to reflect on the history before we talk about the path forward. In fact, in the original Magnet study, it came to light that through staff weighing in and bringing voice to important organizational decisions, that organizations were able to attract and especially retain nurses. And in fact, that is what has happened through the journey of Magnet, to ensure that professional governance is a core principle. I want to make sure that we don't get hung up by the terms. I want to focus on those principles. There has been an evolution in the language of shared governance or collaborative governance to professional governance. The bottom line is that there is evidence on the value, the outcomes, the engagement, the important communication, the chance for professional development and opportunities and job satisfaction. So I try to say in its simplest form, governance that is shared decision-making, collaborative decision-making are based on the principles of partnership, equity, accountability, and ownership for the decisions that we make. So here I'm trying to share with you the definitions of the differences between shared decision-making, shared governance, or collaborative governance, and interprofessional shared governance. But the important part is, in fact, the definition that Magnet puts to this. And we, in the world of Magnet, believe a dynamic partnership between leadership, clinical nurses, and other healthcare professionals must promote collaboration, must facilitate deliberation, and of course, decision-making. And there needs to be a fostering of accountability, especially for improving patient outcomes, quality, and enhancing work life. And I always say an accountability to the team, making sure that the team is intact and that the team is safe. Decision-making versus, which is participatory management versus shared governance, is laid out in this slide. But the important thing is to think about, what are the goals? What are you trying to achieve? Making certain that staff who have the knowledge and the information can weigh in, that you can participate and you can incorporate your input into all of what's being discussed at the organizational level. Leaders must clearly articulate the guidelines for decision-making. You can't be given a task and not the funding. You must know what the barriers are and what the opportunities are. And leadership style must be as a servant leader. Leaders wanting to help staff, develop staff, and hold staff up. And then we must understand that decision-making must be decentralized, and sometimes decentralized to the unit level, to the individual level, and sometimes in big systems are decentralized to the organizational level. So Magnet, our program, our value for decision making is that there's the expectation of professional governance that is really fixed in the healthy work environment model. And of course, this is not only for Magnet, but pathways to excellence. And there are requirements for structured empowerment and shared decision making. There is no question. We have no question of the significance and the importance of this, and that nurses must have control over practice and must bring voice, give voice to all that is related to the care of patients and that safe environment of care. So there are many structures, decentralized to the unit level, centralized functionally, evolved models that can be interprofessional and may address practice from a really mixed model. And so we, as the path forward here at Almoosa, need to decide what that structure is. And it may vary by organization, and it may vary by the decision being at hand. So at my organization, the Massachusetts General Hospital, we call it collaborative governance, and it's the decision-making process that places the authority, responsibility, and accountability for patient care with the nurses, the practicing clinicians, those caring for the patient, those responsible for the patient care. So it's based on our belief that a shared vision and common goals lead to a highly committed nursing workforce. And we also believe that being held accountable and making decisions for the patients you are caring for actually lead to an enhanced productivity because participation is empowering. So it's nurses will, in our system, we believe that nurses will make appropriate decisions when there is sufficient knowledge and that we understand where we are headed as an institution. So what's the vision and what do you really believe in that my role as a nurse will help in the advancement of care. So this is our interprofessional professional practice model. Our belief system is that nurses and all health professionals, as well as our support staff, should be involved in our professional practice model. And of course, all that we do is around the patient, and our belief is in relationship-based care. And so you see, we believe that bringing all the pieces of the puzzle together really help us to develop the way we are going to improve care delivery. And collaborative decision-making is an important component of who we are and what we do. So the transition to shared decision-making, this path forward that you all are thinking about, I believe is that the journey starts here. The journey starts today with everyone coming together with a collective vision and really understanding what we bring to the table. So it's about decision-making. It really, the destination should never be today. The destination is tomorrow and the day after and the day after and the day after. Always wanting to improve that practice model, the environment of care, and really making sure that nurses continue to add value. So progress is gradual, progress is purposeful. All of the progress should be evidence-based. We really want to have an evidence-based practice. Evidence should be driving who we are. And of course, all of this requires cultural change. It starts at the organizational level, and it ends with me, the clinical nurse, on behalf of the patients that I am caring for. So the best practices to build a culture of accountability is to be a role model, build partnerships, set clear outcomes and expectations, agree on what the organizational behaviors are, practice transparency, making certain that we share the truth, we tell the truth, and we really share what our expectations are. Practice transparency. Bridge the needed resources, making certain that we do not go on a journey when there are no resources, or even if there are limited resources, we should say that. Be transparent about what resources are available. Absolutely celebrate, recognize, and reward contributions, and make certain that the evaluation is always done and it's done together. No surprises, no surprises. So the guiding question is, what committees do you need to effectively manage your practice? How do you set up a collaborative decision-making committee structure where everyone can bring voice? You, of course, want to evaluate practice. You want to evaluate the quality of care. You want to develop new practice models, as well as nursing interventions that are through evidence-based practice. When applicable, you want to generate new research, or you want to bring in researchers who can help you to evaluate. You want to advance diversity, equity, and inclusion. And I call this JEDI, justice, equity, diversity, and inclusion. You want to make sure that this environment is ripe for learning. You want to educate people on practice. You want to have evidence-based practice rounds. You want to have evidence-based practice discussions. They could be book clubs. They could be huddles, morning huddles, where you talk about the latest. You talk about quality and patient safety. You talk about the environment of care. In my organization, we begin every morning with a huddle, bringing in clinicians, administrators, and all support staff. You always want to evaluate resource utilization. In this day and age where resources are scarce, you want to make sure that you're not overutilizing resources, and you don't want to underutilize the wonderful resources you have. And of course, you want to have oversight of the structure. You want to make sure that the chief nursing officer is aware of all that is happening in the collaborative decision-making arena, to make sure that she is ensuring and helping to guide all of you, and really making certain that other members of the organization are aware of what's happening in the collaborative decision-making structure, so they too can celebrate your outcomes. So again, I want to share with you, and maybe one of the things that you're wondering is, what is Jeanette talking about? Do we have examples of collaborative decision-making? Well, I'm going to give you my examples, the way in which I set up the Massachusetts General Hospital. There was the executive committee that really is there to hold up and support excellence in care delivery, and to make sure that there's a level of coordination of what's happening at the organizational level with what's happening in the Department of Nursing. Then you want a coordinating council that brings in project people that are supporting collaborative governance committees, as well as the chairs of the committee, where you can make certain that you are not all working on the same thing, that there is a level of agreement on who's doing what and how things are done. And then, of course, there are all the practice councils. Then there's that almighty evidence-based practice council. You might decide to have a research council, and you might decide to have a leadership council to make certain that staff are being supported. You want a professional development council. You want that diversity, equity, and inclusion. Of course, you want quality. You might decide to have unit-based councils. That's the path forward. You might start at the unit level, or you might start at the organizational level and move down to the unit level, or unit level up. If you have thinking about those advanced clinicians, you might do that, but that would be the last of your councils, and then any other council the organization needs. So colleagues, the future is in your hand. I hope that this presentation really helps you to think about collaborative governance, shared governance, professional governance. I believe you're going to call it professional governance. This is information. These are signals, data input, things for you to think about throughout this conference and how you want to set up your structure for the future, not for today, but for the future. So colleagues, again, I'm glad to be with you, and I want to thank you, and I will be available for questions when that part of the meeting happens. So thank you.
Well, we want to thank Jeanette for this wonderful presentation, and I hope that it will trigger some questions. I already have some questions in my mind. Unit-based councils, organizational councils, so it would be great to discuss all that. I would love to introduce our next speaker, Dr. Julia Kwan. Dr. Julia has been a leader, a teacher, exultant for nursing for all her career. She has served the Middle East for the last 12 years as a nursing excellence consultant. She comes from North Carolina. We come from the same place, Julia. We have so many people from North Carolina.
We were first in nursing.
Duke, we're ruling here today. And she brings to us messages that you will both learn and enjoy. Thank you so much for being here, Julia. We're very glad to have you.
Thank you. So, Shukram, I really feel welcome among friends here because there's so many good people that I have met in my travels through the Middle East. And I would love to take Fatima and Dina home with me because they emulate exactly what we want from every professional nurse, to speak for each other, speak up, and to show off. And that's really what's most important for us. As Maureen mentioned, the origins of the program that is being discussed today come from a study, and it's important that we know because one of the tenets of being a profession is having a practice that is based on evidence. And thus, this program is based on evidence, in addition to a long history of nurses who've come to us from the Middle Ages, through the Crimean War, and to the nurse leaders across the globe who have exercised their voice since the 1940s, 50s, 60s, and henceforth. And that is who comes before us and has raised us to be the nurses that we are today. So in 1981, a task force was put together for nurse leaders. One of the magnet conferences I attended, there was actually a rocking chair on a porch where they told the story. But to hear the story from these four nurse leaders over my career has been one of the most inspiring things that we could do. You can be that nurse leader yourself who inspires the future for nursing every day. So it was supported by 7 nursing organizations, and it was funded by 2 corporations. And interestingly, one of them was a big oil corporation. So there is a general purpose among the economy to support good health care, and that comes from what? Good nursing practice. We know that. 41 hospitals were part of that initial study, and 3 themes emerged, and these are the same themes that you've heard be discussed thus far today. The purpose of this study was to find out how do we successfully attract and retain nurses. Now, this is during a period where we were coming into one of the biggest nursing shortages we've ever had. Nothing like what we have right now, but enough to give us experience about what does that mean and why do some hospitals have the ability to bring nurses into them. Somehow in my career, I had the privilege of working in only magnet hospitals because of the structures that were put in place that made it possible for my voice to be heard, as well as to help others to be able to lead in their practices. And so they wanted to describe what was possible in those organizations, what happened in those organizations. And the image that Maureen put up on the the slide earlier, that book sits on my shelf. I read it regularly as kind of the guidebook for where we are and how we got to this point. They analyze their results. They publish the details of all the strategies. What does that sound like? Every other nursing research study you've heard, they followed a methodical process, which means that the ideas that you have can become something that is put forth for the ages, for all of us. They invited 165 hospitals, and only 41 ended up being able to participate, partly because they did this across the nation, and it was done through group interviews. They interviewed the administrative team, and they had interviewed the staff nurse team. And when they did this, they were able to look at the perspectives about what does it take to create the right environment for nurses to be successful, to lead the way. While we heard the fabulous story about how the Almoosa Hospital came to be and how important it is, you saw the images of why do we do this? Another tenet of being a profession is that we have a unique relationship with our client. And I love the image of the patient's hand and the nurse's hand, and we don't know where one ends and the other begins. And so that's what makes this extremely powerful for us. So in doing this, focused on the themes of administration, because it does take visible leadership, it does take transparency, it does take listening by that team, but also it takes a professional practice. So another tenet of being a profession, shared governance. You've already heard that today. And then we have to have professional development. There's something that I learned a long time ago, that I'll never know anything about everything or everything about anything. And every day I need to learn from those around me. So I continue to have a full-time faculty appointment in addition to my day job, which is having the privilege of improving nursing practice for the people that I serve in my organization and making sure that all the doors are open for them to be able to achieve whatever they want to achieve. So you put that together, and there we get to the fourth tenet of a profession, and that's autonomy. And yes, there will be a test later. So there were 4 tenets I mentioned, and I hope everybody's got them jotted down. So as we look at the original study, it's really important to understand that they had some very important findings, and I flipped a slide too quickly with my thumb, excuse me. Okay. So the findings were that management style made all the difference. Now, business industry has been studying for quite some time what is it that keeps people, and it's good leaders, good people, good leaders. They have to go hand in hand in order for us to be successful. And there has to be a clear organizational structure, whether it's called a chain of command, a chain of control, shared governance, all of those. There's got to be a way for voices to get to the people who need to hear them. In fact, in our own organization, we have a chief executive officer, much like I understand is present in almost every one of your organizations, who wants to have conversations, wants to find out about what it is that makes this a fabulous organization, and that's how we get the resources for our chief nurse officer to be able to help us to have the right nursing organization within it. We also have to have transparent staffing models. All over the United States, you hear about different kinds of staffing structures, different models of care, and different ratios. It's most important that that is transparent to people. It doesn't mean that one is necessarily much better than the other, but it's got to be clear what we have. And that we have to have good personnel policies. And, the United States legal system makes it very necessary to have really good legal policies. I actually admire the fact that people in the Middle East are very good at being compliant without having to have a number of policies in place. It is one of the gifts that you have that you should be able to recognize and honor as being extremely valuable. So the structures that have to be in place then to help, you've got to have a positive, harmonious work environment where there is an opportunity for everyone to share ideas. I've been in healthcare for 50 years now, and yes, I did start as a teenager. The difference is that when I began, it was very much an individual sport, and now it is a team sport, and every member of the team has to know their position on the team and know how to work together for us to be successful, because our patients have gotten much more complex over the years as disease has continued to grow despite our research. We've got studies that baccalaureate-prepared nurses give us better outcomes. We'll highlight a couple of those in a moment. And we know that staffing plans give us transparency and clarity to be able to deliver care the way we want to. But there's got to be support for retention. There's got to be listening to folks about what it is that helps them to do this extremely powerful, difficult, saddening, and invigorating work that we do. Think about the energy it takes to deliver care to very sick people who often don't have the same knowledge base that you have about what it is to stay well. Think about how tired you are at the end of the day. That takes leadership listening to how we can help get you through this for success. Professional practice, we know that we have to have quality patient care. We've heard about professional practice models. We need to have them because they guide our nursing practice. We have to have consultation and resources because you can't know everything. We have to constantly be teaching each other and learning from the literature. And we've got to think about what the image of nursing was or is. You know, one day, many, many years ago, I was on the phone with Jeanette Erickson. And she said, "Excuse me, I have a photographic emergency." And I continued the call. I was the facilitator of that particular call. And when she came back, I said, "What's a photograph emergency?" She said, "We don't take pictures for our organization, for the press, about a patient unless the nurse is in the photo." And this nurse was refusing to get in the photo. So she got her into the photo, and everything was better. But it's a team, and that's what she was trying to emphasize here. To that end, we've already heard about autonomy, self-regulation in our practice, shared governance, having that professional practice model. What makes your hospital unique from another hospital in terms of how you deliver the care? And every hospital is unique. It's hard to see it when you're the practicing nurse, but when you're the leadership, you know what that special sauce is, that special ingredient in your facility that makes it different. And you've got to have leadership that loves their staff, that lives the life of their staff, and takes risks to lead their staff. And finally, we have our professional development. I am 64 years old. I need people to be willing to do this work, to take care of me, because if I listen to my father, I will live to be 100. And so I need to know that we have succession planning, that we have those who will come after us to continue to carry the messages forth. We do need to mentor, and it's not just our friends at work, it's our colleagues across the world that we spend time with and we learn from. Mentoring's mutually beneficial. We learn from each other and we grow from each other. We must have evidence-based practice, as we've already heard this morning, because without the evidence, we don't have all the justification, nor do we have the rewards, and the rewards come with the research. So we have a lot to do, and you would think by this point in our careers, we would know everything there is to know, and every day there's a new discovery. Someone in here will find the cure for falls, and I promise you there will be one. When we think about that, as you saw this morning, structure, process, and outcomes, we've got to have all of these tools available to us for us to be successful. So to that end, there are outcomes of being professional and being a member of a profession. And it's not just your social image. It is how you carry yourself and how you lead through education and leadership, setting goals, measuring metrics, and having positive outcomes. So the references here are here to show you initial studies that have continued over the decades. There are resources available to us from a number of sources. And as you can see, I've got listed the original study, I've got the Magnet Revisited book, but I've got an example of studies on the value of shared governance, on the value of education, the value of staffing, and there are hundreds of studies that show it. The studies need to come from this region of the world to make the same emphasis that have come from other regions of the world to demonstrate our successes. Now, it's really interesting that, we're all putting quotes in there, but I think it is important to know that pleasure in the job will put perfection into the work, and that comes to us from thousands of years of thinking about what it takes to exist in our society. So, our focus on professionalism is what's most important. The rest will come. Nursing excellence is that result. So thank you very much. Appreciate the privilege of being with you.
Thank you, Julia, so much. I'm receiving some questions for you already for the panel discussion. Okay, we will be taking a short break, a 15-minute break, so that you can grab coffee and a small breakfast. When we come back, we will be talking about application and implementation of Magnet in the region. So grab your coffees and come back.
Dear. اللون ميرسي منيح بس يرجعوا من البريك.
a national level, she has served as a member of the executive board of the Jordanian Nursing Council. She has many publications as well as presentations in international professional meetings. In 2013, she was the first winner of HRH Princess Munal Hussein Award for Nursing Leadership in Jordan. It's a pleasure to have you here, Dr. Majida.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. It's a great pleasure for me to be among the esteemed and distinguished colleagues and nurses from Almoosa Hospital. Firstly, I would like to start by thanking Almoosa Hospital really for all the efforts and the achievement that you are doing for the healthcare in this beloved country, which we consider our second home. And thank you, Ms. Hera, for the invitation to be in this conference. And excuse my speedy talk, because Ms. Hera, she asks me to squeeze a 10-year journey in 10 minutes. So each 1 year in one. We got our first magnet designation in 2019, and it was the 10th hospital outside US to achieve such distinction. And you know, for cancer center, it's a little bit different from other institutions, especially dealing with the outcomes. And we have our previous colleagues also, he's sitting here. He knows some of the challenges that we had about our eclampsia, COTI, et cetera. But KHCC different unit, the nursing unit show improvement over time in doing well with these indicators as well. I think. Yeah, okay. So it's God gift. So this is KHCC, thank you so much. So this is the KHCC, actually this is the new towers at KHCC. It's the big towers where we have the outpatient and the inpatients. And we have the bridge, this is the bridge connecting to the old building. Next slide, please. So, we have more than 1,000 nurses in the center. They are specialized oncology nurses. I can say majority of them, more than 90%, they have their bachelor degree and higher nursing education. This is very quick summary about the continuum of care in Jordan that has been done by KHCC. We have been established in 1996. And the name of the center at this time was Al-Amal Center, which is in Arabic mean hope. And then it was changed in 2003 to be named by our beloved late King Hussein, who died of lymphoma. And in order to set the culture for the Jordanian people that its cancer is not a taboo, it is something that we can treat. It is a chronic disease that we can deal with. And then we established the database. And of course, now After 2017, there is great emphasis on doing research and evidence-based and the clinical trial, and we have launched since 2 years so far King Hussein Award for Cancer Research, and some of the awardee actually was from Saudi Arabia. Hopefully Almoosa will be on the map next year. Next, please. So this is the accreditation that we have. We already spoke about it. Next, please. This is our photo in the magnet. This is very dear photo for myself with the team during our first designation. And to start with the journey, actually, the support that we have at KHCC is major and tremendous because we have the support from the royalties. So Her Royal Highness Princess Muna Al Hussein, she is the sponsor and the patronage for healthcare and nursing in Jordan and the region. She supported us. And I remembered years back, whenever she saw me, she's telling me, Majida, when? Majida, when? So we are working on it. So the great support that we have from her, it's really unparalleled, and it helped us a lot at KHCC to achieve and do what we are doing. Also, the chairperson for the KHCC Foundation, Princess Ghida Talal, also she is a great fan of nurses, I can say. She is a great supporter as well. So this is very important when we planning to create the culture, because you need this kind of support and vision and strategy. And let me pause just for seconds here. Really, yesterday I have the privilege to visit Almoosa Hospital different units and to meet with the wonderful team and the wonderful nurses that you have. What I was telling the group is that I saw the vision and the determination of the hospital leaders in every corner that I went to. So when we spoke to the nurses, to the team, really they spoke very well to your strategy, to your future direction, which is very important in order to build the culture for excellence. So next, please. So we have, as a result of this strategy building, we have the magnet. It's mentioned very explicit in our strategic plan. So, and this was on purpose by our CEO, Dr. Asim. Actually, he mentioned that we will put it clearly and explicitly for everyone that KHCC is going for magnet. So everyone in it took the entire house to know and to build, because it's not only about nurses, it's not only about one single department, it's about the full house. So it was mentioned, so everyone at KHCC speaking about, yes, we are going for magnet, we are attaining magnet. And also, it was like my duty. Majda, remember you have this duty on the strategic plan. So next, please. So moving into the journey now, once we have it in the strategic plan, and it is there, now it is our duty to make it live and to make it happening on the ground on every single unit that we have. So these are the four major steps that we follow, and I think any magnet hospital will go through the same way, which is establishing the structure processes and working on the enculturation, application, and then documentation submission, and then the site visit, which we will hopefully enjoy at Almoosa Hospital very soon, inshallah. So the major part was establishing the structure and the processes. It is not only within the nursing department also, but as a CNO working with my colleagues on the C-suite, as well as with other departments like the quality department, purchasing department, CFO is very vital in this journey. So it was very important also to building those channels and set the expectation from everyone, especially outside nursing, that this is going to happen, and this is what we need, and this is how we are working together. So it's not, we cannot keep working in silos if we are looking for a culture of excellence and such as magnet culture. Next, please. Okay. So for establishing the structure and the processes, and sometimes I sit back and remember those times when I started to work with my colleagues to build the shared governance in my hospital. And I remember I was in a big room like this. It is the exhibit room, the auditorium at KHCC, and we have around 300, 350 nurses. And one of the nurses, he just stand up and he told me, why you want to go for shared governance? Why you wanted to do this? We can't do it the easy way. You are the CNO, you decide, we will follow. So they trust me, thank you. But then, what I answered at this time, and it was around 2012, I told him, we are doing this because starting immediately, this is how nurses doing their business at KHCC. This is how I lead you, if you accept that, and this is how we are going to work for this institution. So it's not for Magnet, as mentioned by Lorraine, thankfully previously. It's for, this is how we are doing our business. It's not more the old ways. So we built the design team. The design team was the nurses engineers, I called them at this time. We work with some of the clinical nurses managers, and they engineers the way for us. So how we are going, what we are what we are going to do, how we are building our structure, our PPM, etc., etc. And then we started our shared governance structure. Of course, we have the enrollment with the quality indicator, with the NDNQI. We started our nurses satisfaction survey, BBM, and of course, the research and evidence-based unit. And we have 2 PhD holders. They are running the nursing research just to help nurses doing research and evidence-based. So this slide, actually, it shows the involvement of the nurses in the shared governance. We started in 2012. Only 6% of the nurses, they participate. And you know what? It's not about shared governance. It's about how you make shared governance working in your hospital. It's not only putting the structure, because it will be nice on papers, but now how to make it work and how to help the nurses to live this governance in a shared way. So we started by 6%, only clinical nurses, and then we moved. Now we have around 35 of my nurses. They are enrolled and help in shared governance. And KHCC was the first in the Middle East to be accredited by the shared governance with Dr. Bob Hess. We used our IBNG, and actually I have the honor to say the first paper that we have published or participated in, actually it was with Ms. Hera in 2013 when we published about our shared governance. So this is basically the structure that we have the UBC in the middle, in the heart, so they are the base for all other shared governance councils. Yeah. We measure the nurses' perception for shared governance council many times to make sure that it's really inculturating and working well. So the first time, as I mentioned, was in 2013, and then 2020, and then lastly, it was in 2022. And always we have measured in the range for shared governance. And actually in 2020, we have participated in other multi-site study as well, where our hospital showed the highest perception for shared governance among nurses. So we keep measuring how we are doing, and we published in many times. So if this is to your left side where I shared with Ms. Hera, yeah, and this is we have other more studies talking about the shared governance. And to the right side, if you read the book about shared governance, practical tool for interprofessional healthcare, our story is there. We have published in 3 editions in this book, so our story is there. You can read it and know what's going on at KHCC. So CNO visibility, it's very important, very critical that the nurses can access their administrators and their leaders. So we have the CNO monthly meeting. It is a celebrity, actually, it's not a meeting. In this meeting, every month, some unit will volunteer doing the meeting. They organize everything, and it will be like celebrity. They come with usual dress. It's like wedding. I don't know wedding of whom, but they come all to celebrate. And it is really a nice gathering where I can see a big group of nurses to interact to each other, have some fun time, The open door policy, very important. Of course, the rounding, the councils, phone, email, communication also. So these are examples of the C&O meeting that we have. And you can see I am sitting on the floor with them. They ask me to do so, then I obey commands. so it is really a very, I wait every month for this meeting, and even during COVID, we did not stop the C&O monthly meeting with our staff. We do it virtually in order to keep the momentum, and especially in this hard time. Daisy, we have many Daisy awardee. It is very compassionate, touching moments for the nurses at KHCC, and last year we introduced at the end of the year the Daisy for the team. So in the middle, team of nurses in the pediatric group, they did an amazing job in using some of the crushed ice to decrease the stomatitis for the children, and it went very well. The feedback from patients and family, it was amazing. So we give them the Daisy team. It was the first one. We have leaders, we have clinical nurses. RN satisfaction survey, just an example. We have done so far 9 rounds of RN satisfaction survey. I cannot squeeze them all in one slide, but I put 4 examples. I always use the red and green color, where red is still below the benchmark, and the green, we outperform the benchmark. So this is, it shows how we transform what we are doing. So we started by multiple reds in 2012, and now we have almost all, majority are green. And this is why, because the nurses, they own the RN satisfaction survey. They own it, they took the results, they work on it in their UBC, they come, they ask me for support, I provided the support, that's it. So really when they own it, and they know that they have to work on it because it's them, it's not their administration, this is the results. So I'm always telling, this is how Jordanian magnet nurses look like in US. So this is me with my team in 2019. And by the way, some of the Saudi nurses, they try to take the shmag from us. So it's also, we can take some money for it. So this is in the last designation, and now we are moving to our second designation. Hopefully, maybe we will be in the same year for celebration, inshallah. Thank you so much for active listening. I think it's 10 minutes. Thank you.
Dr. Majida, wow.
Thank you.
That was such an engaging and
Thank you.
lively presentation. Thank you so very much.
Thank
and
you.
did it in speed time.
Yes,
Thank you.
speed.
Well done. I think a lot of people will have some questions for you. Well done. Great. I knew we had a lot of common things. It started with shared governance and then maybe sitting on the floor with all the nurses. I'm going to present our next speaker now. Her name is Rosemary Paradis. She's the CNO of King Faisal in Riyadh. Unfortunately, Rosemary, she couldn't be here today for a family issue that she's taking care of, but she has recorded her session. So Rosemary is the Executive Director, Nursing Affairs at the King Faisal Specialist Hospital and Research Center in Riyadh since March 2015. In her 30 years of nursing, Ms. Paradis has held numerous leadership and executive positions. She is a commander, Nurse Corps United States Navy, retired, with over 20 years of military nursing service, and has held senior nurse executive positions in the U.S. Veterans Health Administration in Washington, D.C., Hospital Center in D.C., and internationally at the King Faisal Specialist Hospital and Research Center in Riyadh. Ms. Paradis is a visionary and transformational leader with a focus on quality, patient safety, and service excellence, and has expertise in executive nursing practice, nursing workforce development, and succession planning. She holds a Bachelor's of Science in Nursing from the University of Tennessee, Health Science Center College of Nursing in Memphis, and a Master's of Science in Management Manpower System Analysis from the Naval Postgraduate School of Monterey, California. Ms. Paradis is a fellow in the American College of Healthcare Executives, and we are very happy to introduce her here with her talk. She's also going to talk about the KSA experience of implementing and applying Magnet.
Good morning. I'm delighted to be here with you this morning at the Almoosa First International Conference to present the KSA Experience, King Faisal Specialist Hospital and Research Center Magnet Recognition Program Journey. I'd like to thank Ms. Hera and Mr. Malik Almoosa for your kind invitation and the organizing committee for a robust conference agenda. As I prepared my remarks for this talk, reflecting on our experience, I decided the best way to present a high-level overview of our 15-year journey in 10 minutes was via a timeline. In the interest of time, I've omitted an organizational overview slide, but by way of a brief introduction, the King Faisal Specialist Hospital and Research Center is comprised of 3 sites, Riyadh, Jeddah, and Medina. My talk today is about the King Faisal Specialist Hospital in Riyadh. We're nearly 1,000-bedded tertiary quaternary hospital, Joint Commission accredited, Magnet designated since 2014. We currently have approximately 4,500 nursing personnel. 3,500 are staff nurse positions. So let's go ahead and get started. The 15-year journey. Many times when we get started on the journey, if we think about the end in mind, we don't know exactly where that end is, right? So here's our 15-year journey. Began in 2009, 2024, and I think you'd all agree this is a very busy slide. Again, if I can orient you to this slide, on the top are the initiatives, strategic or operational initiatives that were put in place over these past 15 years. Underneath the timeline are those activities, as you would recognize, for application and for the Magnet designation and the whole process. So we'll break this down into the 3 segments: the first designation, second, and the third in process. So to start with, our journey began in 2009. We, like most of you, would begin with exploratory discussions in your organization, unit level, council level, perhaps nursing body-wide. We also then registered with NDNQI to begin collecting and benchmarking ourselves against the NDNQI nursing quality indicators. Next, we cascaded those results, quarterly results, down to each and every unit. In 2010, we began with our very first NDNQI satisfaction survey. You can see in 2011, we actually officially launched our Magnet journey. We did a second satisfaction survey in that same year, and then submitted our first, Magnet, demographics data collection and interim reporting tool or submission. In 2012, you would have seen our third survey, and so our third survey, we achieved outperformed the mean on 4 out of 10 indicators. Then in the same, you can see certainly in the same year, 2012, we submitted our first Magnet application. In 2013, our organization expanded the patient satisfaction surveys to include HCAHPS. Very helpful for us to have that, benchmarkable data for us to compare ourselves to like type units, in addition to NDNQI. We submitted our first Magnet document submission in 2013, and we did a 4th survey. Our 4th survey were similar to the results, same as results of our third, so we achieved or outperformed 4 out of 10. In 2014, a wonderful year, a great year for us. We achieved our first Magnet site visit, and then, we're awarded our first Magnet designation. In 2015, beginning our second Magnet designation journey, our hospital updated again our patient satisfaction surveys, helpful to us as we begin to try to look at the impact of our care and the impact on our patients. Our 5th survey was completed, and our satisfaction survey, and we achieved 9 out of 11, or outperformed 9 out of 11 of the indicators. You can see as well that we submitted our second Magnet demographics data collection and interim report tool. Did a 6th survey, and so the 6th survey, we see that we achieved 12 out of 14, so we're feeling pretty good about that. Likewise, at the same time, you can see that we launched some of our nursing affairs quarterly NDNQI report cards. In a nutshell, this is taking the data, which was cascaded previously down to each and every unit level, organized in a report card, several pages, could be printed up, but also was on our intranet for our frontline managers. But more importantly, it was grouped by each of our departments or programs, so those directors could really look. Number one, the nursing quality indicators. These are KPIs, SMART, specific, measurable, achievable, realistic, and time-bound objectives or indicators for that performance year. So patient experience, patient satisfaction, RN satisfaction, the NDNQI indicators. We also, the last two indicators or the last two SMART objectives really related to either something from the HRO journey as well as maybe access standards. So we feel that's a tipping point, and you'll see that in the next slides, but embedding that into the process really helped us to kind of gain some momentum on all, each of those particular indicators. 2019, again, a wonderful year for us. We had a second magnet site visit. We were awarded our second designation, and we saw with our eighth NDNQI survey, we achieved 10 out of 11. Actually outperformed the mean in 10 out of 11 of the indicators. So moving on, the third designation journey. So, I won't repeat it, but, each year at the beginning of the year, we revise our EPM objectives, our SMART objectives, cascade them down. And, again, they're sort of, part of our day-to-day operations, our work ethos. And so it's helped us to drive change. 2020 looks pretty bare there, doesn't it? But I think that you, as well as we shifted our efforts to the pandemic, and our focus, as I know yours was, to keep our patients and their families and staff safe, but moreover to provide the highest level of care to our patients, families, and staff. In 2021, you can see that we did our 9th survey. Even amidst, the pandemic and the issues that might have, occurred around that, we saw, outperforming 11 of 14 on our survey. We submitted our third, DDC and interim report, and in 2022 submitted our third magnet application. Our 10th survey, we're delighted. We're not perfect yet, and I don't think that even if you get to 14 out of 14, we're at 12 out of 14, outperformed in 2022. We strive to get to 14, and once we get to 14, we certainly will add to that and continue to improve ourselves. So 2023, where are we at? What's on the agenda for us this year? You can see that in August of 2023, we will be submitting our third magnet document submission. Inshallah, 2024, we will have our third magnet site visit as well. Hopefully being awarded a third magnet designation. So, that being said, begin with the end in mind. This is a 3, designation journey. It will, hopefully, continue on. And, with that, I will, just encourage you, while ours is a 15-year journey, it's been one designation at a time. And I certainly encourage you in your journey at whatever institution you come from. Wish you all the best. Thank you very much. And I will be delighted to take.
Thank you, Rosemary. That was great. So far you have seen that we have covered the magnet CNO perspective. Next, we're going to be talking about the magnet program director perspective, and that's how I'm coming to introduce now to you Alik. Ms. Alik Saryan, she is a Magnet Program Director and Nursing Quality and Safety Director at Almoosa Specialist Hospital. She received her BS degree in nursing in 2005 from the American University of Beirut. In 2012, she received her graduate degree in nursing administration from AUB and began her new role as a Magnet Program Director at AUBMC, where she led the hospital in attaining 2 consecutive Magnet recognitions, 2014-2019 from ANCC. In 2020, she relocated to Saudi Arabia as Magnet Program Director at our hospital. She graduated from Safety, Quality, Informatics, and Leadership Program at Harvard Hospital in 2021, and she assumed an additional role as Nursing Quality and Safety Director. Alik is currently pursuing her master's degree in Healthcare Quality and Safety at Harvard Medical School. I cannot do this without you. And what's a CNO, Magnet CNO? Without a Magnet Program Director, you've been a partner, a backbone, a cheerleader, and a very hardworking person. I'm proud of you, and the floor is yours.
Thank you so much. Well, as an MPD, I can start by saying I cannot do it without the staff of Almoosa, and specifically, I would like to dedicate this session to the nursing department and all of you nurses. Yeah. And what makes me humbled and privileged and so happy to present this, because I will be presenting what our great Almoosa nurses do every single day. And I will try to summarize what we have done and what we do. As an MPD, for those who know what MPDs do, we wear so many hats. Our boots are on the ground with all the nurses, and we do so many things. And we have one aim, as Dr. Maureen mentioned, it's all about excellence. It's all about planting the seeds of excellence and growing it and making a difference every single day in the lives of our patients. Well, how did we do it at Almoosa? To give you a perspective of the Magnet journey at Almoosa, well, it started since the hospital was developed in 1996, because the mission and the vision always aim to provide excellence for our patients. And as, again, I will quote Maureen, it's not about getting the Magnet, it's about providing excellence regardless of Magnet and all other accreditations. We applied our documents in application in October 2021 and submitted our documents, the first private hospital in the kingdom to submit their Magnet documents in October 2022. And we are just 10 days away, and we are counting the days to receive the reviews of our Magnet documents. So just to take a tour from the eyes of our Magnet journey at Almoosa, transformational leaders. We do have transformational leaders in our hospital, whether in the hospital or the nursing department. And when we say we have great leaders who create great structures, whether in the foundations from our mission, our nurse leaders, we have strong mission that supports the resources for all our nursing staff. We are so proud to say that we have 88% of our nurses who are bachelor's degree, and we maintain their development to strong foundations like the transition to practice program, the performance appraisal, and of course, having the strong research structure. So when we have great leaders like we do in Almoosa, we definitely have empowered nurses who work through the strong foundations and they continuously develop. We are so proud of our 9 shared governance councils, and we have 276 nurses who make around 45% of our nurses actively engage in those councils, who are engaged in professional organizations, and who face all the challenges of being an international nurses and maintain their certifications. We are so proud of our transition to practice nurses, And as you can see, the number is a huge number, but we highly believe in the education and that this is how we create our empowered nurses. And we cannot forget our commitment to the community because we believe excellence goes beyond the walls of our hospitals. It goes to the community and something we are so proud of. Again, you might ask, how do you do it in Almoosa? We have the great leaders with great structures create the great nurses. And it's not only about the nurses, it's about all the departments, all the staff, the interprofessional team. When we collaborate together to get and provide the exemplary care for our nurses. Yes, there are so many requirements for Magnet, and sometimes we do believe they are so strict and tough and cause a lot of stress, but we do it with pleasure, and we are so proud when we sustain and attain those outcomes. We do sustain them, and our aim is not only to sustain, but to make it scalable across all units and across not only the nursing department, but all the departments. Yes, the 3 big data, we managed to outperform it, the RN survey, sensitive indicators, and the patient outcomes. But what makes it more rewarding is day-to-day excellence that we provide to our patients, again through collaboration, like our PI projects, the CLAPSI, the COUTI, how we collaborate with all the departments. And we like to brag, and this is something we say to ourselves, let's brag that we are privileged to bring the technology and the innovation to our practice. And we are able to have and elevate this quality care that we are providing to our patients and the community. And as some of you and our speakers have seen it, you are all welcomed. We are having tours to our hospital. You are free to sign into those tours and see the great technologies and innovations we have brought to our practice. Innovation is something very important. Research, evidence-based, and technology, they come hand in hand. And we are so proud, as mentioned before, our nurses are highly engaged in doing nursing studies. They are engaged in publishing and disseminating those studies nationally and globally. And we cannot be more prouder. And we are able to do it. And I would like also to thank the academic affairs. They are true partners with us, especially when it comes to the nursing research. Now, at the end of the day, just to give you a summary of how we do it at Almoosa, yes, we do it to provide excellent patient care, and we have been able to continuously improve our patient outcomes, our patient experience, decrease mortality, falls, all our indicators. We are glad to say that our empowered nurses continue to improve their knowledge and skills, their autonomy. We are so proud to know that all our nursing units have outperformed in the category of autonomy in the RN survey, and this is something that we are so proud of. And of course, for the organization, Magnet is not only for patients and excellence, it is for our nurses, our staff, and also our organization. And to sum up how we do it at Almoosa, we do it through collaboration, innovation, and how we manage to cultivate everything in our daily practices. As our motto says, collaborate, innovate, cultivate. Thank you so much.
Thank you, Ali. Out of curiosity, how many Magnet program directors in the audience? There you go, King Fahad. Stand up. Great. Any other? Okay. It's good to have you here. So we spoke about the CNO perspective. We spoke about the MPD perspective. Now we're going to talk about the RN perspective. How does it feel to be a nurse in a Magnet hospital? I introduced to you Nicole Daguer. She's a graduate from the Rafiq Hariri School of Nursing at American University of Beirut in 2017 with a bachelor's degree of science in nursing. Since then, she has been working as a registered nurse in the emergency department at the American University of Beirut Medical Center. Currently, she also works as the unit-based clinical educator for the emergency department. Her role entails ensuring that nurse orientees receive the proper training and support
as they start their first year, as well as educating the current staff on new practices, policies, and procedures. It was my personal honor, privilege, and the thoughts of the organizing committee to honor the first magnet hospital in the region, American University of Beirut. We have Hisham Bawadi, who is the Director of Nursing at the UBMC right now. We are very proud of having you starting the journey in the region, and it only has had a rippled effect. We're very proud of the work that you have done, and we're very proud of having you here. Please have questions for them during the panel discussion, and Nicole, go away.
Okay.
Start away.
Good morning, everyone. I just want to start by saying that it's really an honor to be here to represent my country and to also share my perspective with everyone here. I just want to start off by telling you a little bit about myself. So my name is Nicole Dagher, and I currently live in Beirut, Lebanon, but I grew up between two countries, America and Lebanon. And ever since I was a little girl, I knew that I wanted to be in the medical field. So I worked really hard in high school, and I had to make the decision upon graduation whether I wanted to become a vet or become a nurse. And I finally decided I wanted to go with nursing because I didn't want my patients to scratch me. I didn't realize that risk was present in both careers. So I graduated from the American University of Beirut in 2017 with a bachelor's degree in nursing, and I jumped headfirst into the emergency department in the parent hospital, the American University of Beirut Medical Center. And I chose AUB. It was honestly the only hospital I applied to. I chose AUBMC for multiple factors. First of all, AUBMC is a private, not-for-profit academic center. Its mission and vision also aligned with where I wanted to go with my future, so it's focused on education, research, and compassionate care, and it aims to become a multi-site center and provide care to the region as well. It was also the first hospital in the region to attain the 5 international accreditations and designations that are stated here, and we also have the ANCC accreditation as well. AUBMC's core values were also very important to me, and I knew that I would fit right in a hospital that valued stewardship, diversity, integrity, respect, accountability, and teamwork and collaboration. So from the year 2017 to 2019, life was great, and I excelled in my career as a nurse, and I learned many new things every single day. However, in October 2019, we started to have the revolution and the beginning of the collapse of the economy, and that created a lot of hardships. There were riots that were going on, and as a Lebanese citizen, I think I can speak for everyone when I say that as Lebanese citizens, we had a lot of hope during this time, hope for change and hope for the future. But as a nurse, it was a bit more complicated. We had to take care of the people who were coming in, the citizens who were hurt from all the riots, but we also had to take care of the police officers who were hurting those citizens through the use of tear gas and rubber bullets and everything else. And so as nurses, it was very hard for us to comprehend how we felt in that situation. And then January 2020, and we started to have the first waves of COVID. And as a hospital, we tried our best to prepare for the influx of patients that we knew was going to hit. But nothing could have prepared us nurses for the psychological and the emotional stress that we had to go through while taking care of these very sick patients. And we thought the worst was over, and then we have August 4th, 2020, the Beirut blast. And honestly, no words can portray what I would like to share about this and how difficult it was for us as a society and as a hospital. So I'd like to show you a short video.
Can you just play the video at the end of the presentation? Sorry.
Oh, yeah, sure, no problem. So we'll show you the video at the end then. So we had about a year to recover after the Beirut blast, and then we went into our fuel crisis. Lebanon ran out of fuel. So that was also a very difficult time. I remember personally waiting in line for 3 hours after a rough night shift to try and get my car filled with gas so I could go to work for the next shift. And a lot of us were also concerned about how we were going to see our families over the weekends, how we were going to get to work, and it was very difficult for everyone. And after the Beirut blast and the years that followed, due to all of these hardships, we had a lot of Lebanese citizens who decided to leave the country, and that translated into a mass exodus of nursing and medical staff from the hospitals. So it was also something that we had to face as nurses. But despite all of these hardships, we were able to rebuild and we were able to maintain our level of care in the hospital. And as I was preparing for this presentation, I started to think of what factors helped us overcome all of these difficulties. And I came up with a few. The first one being that we have really great leaders. And so our leaders were always available with us. For me, it was they were available in the emergency department, and they were always on the floor. They were willing to identify gaps, and they were also helpful in improving those gaps and improving workflows. And that made life for us in the ER a lot easier. And our leaders were also avid providers, so they provided for us. They would listen to the wants and needs of their team members, and they would find ways to help them out. And I remember driving home one day during the riots, and I had my windows down, and all of a sudden my eyes start to tear up, and I start smelling something funny, and I realized what I was smelling was actually tear gas, the remnants of tear gas. And I remember feeling in that moment very, very unsafe. Like, what if there are riots going on the street right next to me on my way home? How am I going to stay safe coming and going to work and just in general in the country? And I remember a few days later, our leaders were actually very helpful, and they provided us with dorm rooms, and they said if we ever felt unsafe or if we couldn't get home, that we could, use those dorm rooms. Thankfully, I never had to, but I know a lot of people that did. As well, during the fuel crisis, they provided us with public transportation and buses that we could use to shuttle us from home to work, so that was also very helpful as well. And our leaders aren't just only providers, but they're also looking at us with open eyes, looking at us and finding people who are able to take on new responsibilities. And through our succession planning, they're able to raise those nurses and give them extra responsibility. And that happened to me personally. I was chosen to become the unit-based clinical educator for the emergency department. And it's also happening currently to one of my colleagues who was given the responsibility of becoming responsible for the whole pediatric emergency department unit and improving the clinical workflows there. Another factor that I identified was that we have a structure in AUBMC that's set to empower us. So AUBMC works under the concept of shared governance, and as you can see, we have 9 councils that work together in order to make decisions. And some councils are made up purely of nurses, while other councils are made up of nurse leaders and nurse managers. But it's really important to point out that each council has at least one nurse representative. So this means that any decision that's made in a hospital level has the input of the nurses. So council members, they represent the voices of the nurses on their respective units, and they work together to enact change. And they're also responsible for the revision of policies. And so that means that no policy is implemented without the input of the nurses. And again, this is something that I experienced personally when I was elected to become the chair of the Clinical Professional Advancement Council for the emergency department. So all of my fellow members are actually nurses with me, and it's so satisfying to know that we've made several changes in the way that the ED works. The third factor that I was able to identify was the fact that we have excellent professional practice. And I attained this to the fact that as nurses, we're autonomous. So we're able to make our own decisions in conjunction with the medical team, and that makes us as nurses feel empowered. And empowered nurses are also satisfied nurses. So at this point, I'd like to point out that during the COVID crisis, we had to fill out the RN satisfaction survey, and we actually outperformed this indicator. So that means that even though a lot of nurses left, they were leaving not because they weren't satisfied with their jobs, but because they weren't satisfied with the way the country was going. And satisfied nurses are also nurses who can focus on the clients. And every decision that we make is a decision based on helping the client heal and become better. And so our patients realize this and they end up trusting us, and that means our patients are also satisfied as well. We also had a supportive team environment. So again, during the COVID-19 crisis, there was just an overflow of patients in the ER. I remember we had 2 patients kind of shoved into a room that could only fit 1, and it was very, very stressful and overwhelming, but the hospital was just so great. We had nurses from the specialty clinics, from the medical surgical floors. We had even nursing students who volunteered to help us out in the emergency department, and they really took off a large load of all of that work, and we were able to work together as a team and kind of support each other. We also improve and innovate, and so we work under evidence-based practices, and a lot of these times nurses themselves initiate this evidence-based practice by bringing their ideas to the councils, and then they also implement them through the work of the councils. This means that we can still provide the best possible quality of care to our patients, because as nurses we feel supported and encouraged by our leaders and by our environment, and that means that us as nurses, we're satisfied with the job that we're doing, and our patients are also satisfied as well. And that means that we can outperform established quality indicators. So if you look closely at the 5 factors that I was mentioning before, they're all actually magnet components. So there's structural empowerment, new knowledge, innovation, and improvement, exemplary professional practice, transformational leadership, and all of them include empirical outcomes. And so this is what being a magnet hospital means to nurses, and this is what being a magnet hospital means to me personally. And so currently I'm very happy that we're going through our 4th magnet redesignation and our 6th ANCC reaccreditation. And this wouldn't have been possible without the support of the leaders and the team and the nurses themselves, and without everyone here as well. Thank you.
Thank you so much, Nicole, for sharing your story, which is a very dear story to me. We're going to take a few minutes break. We're not going to go out. I'm not letting you out. You can just stand up and stretch for a few minutes, and then we're going to take 2 more talks, and then we're going to have our panel discussion speakers on the stage. Just a stretching break.
you something about Saudi Nurses Association, but let's the results prove the Saudi Nurses Association's efforts from the members and executive members. And their website is there. Today, I will share from my perspective the national level of our new Saudi Arabia. Actually, with the great support of our governors, this is a great opportunity to invest, especially within the current transformation happening in Saudi Arabia, to do something for the nursing profession. And the first thing you have to do is to know, realize, admit your weaknesses. Like any other countries, we have our own challenges. And two things you need to assess in your nursing workforce at the national level. Capability, first, capacity, and then capabilities. So, from the current statistics and expectations first, Saudi Arabia is coming for a huge actually transformation and a lot of expectations from the high level of leadership in the country. The current challenges, actually, we talk about the ratios approved by the WHO, just measuring your quality of life and well-being. So we will see your bed capacity ratio to the population. And then you have another challenges like obesity rate. 35% of our population within the obesity rate level. Again, another huge challenge is the prevalence of hypertension among adults. It's nearly 23%. Not mentioning 3.8 million diagnosed as diabetes. So you need a rapid growth within the rapid growth of population. You have to meet the need for healthcare expansion. Rising cost of healthcare, it's another challenge. Higher workforce demand. And without mentioning the traffic, I think you can notice this from the first time you came from the airport to our roads. The result, traffic fatality rates. And this will lower our targets, the main number one rate, which is the life expectancy rate. So among these challenges, especially with the higher workforce demand, need nurses. You will not be able to operate a single bed without nurse. So what's our current? Okay. The capacity. Either you or me. Okay. Okay, slide. I promise Ms. Hira for 15 minutes to be presented. 10 minutes, okay. So, one slide ahead, please. Okay. Currently two slides ahead. Okay. Okay. Currently in Saudi Arabia, we have, you can just, before guessing, know exactly how many? 217,000 nurses working in Saudi Arabia from more than 60 countries, different countries, in different healthcare settings. So, despite this huge number, the rate of nurses per 100,000 population is only 614. So compared to other countries, like United Kingdom, Canada, it's way lower. So the target recommended international ratio is 700 for or per 100,000 population. We should have at least 243,000 at least to meet the standard of 700. So this is another challenging issue. Next. And why I mentioned Philippines, Jordan, Saudi, I mean, this is the Saudi national. The 640 is the total. If we will exclude the expats, so we'll have only 228 only Saudi nurses. So I mentioned India and other countries. Actually, it's not enough to have a high graduate rate of nurses, because if they are not employed, they will not be counted. If they don't have a job vacancies, hospital first, and the job vacancies, they will not be counted. So you need health expansion to provide jobs. Okay, here's another issue. The maldistribution among the regions. This is only the statistics of Ministry of Health. So other like the northern, and I see Mr. Malik is pointing to the northern regions, you'll have very good numbers, like 779 per 100 population. But other regions like southern and western is huge challenges. So this is another issue. Next, please. Next. Thank you. So considering other healthcare institutions, I think the number will be higher. So, okay, where is the challenge? We need higher nursing schools, higher number of nursing schools. Here, if you divide the nurse graduate average, so to 2017 to 2020, we have approximate of like, say, 3,500 graduate nurses every year. If you divide this number by our population, which counts 34 million population, we have only 16.7 rate. So it's a huge challenge where we have to increase the capacity of nurse schools or the academic institutions. Next, please. So it's just a simple formula. You have to measure to balance between the nurse graduate rate and the nursing workforce rate. Because when you have a high graduate rate of nurse versus no jobs, vacancies, here you will have high unemployed level and high nurse migration rates. And the opposite, when you have a high nurse workforce rate versus a nursing graduate or lower nurse graduate level, you'll have a high job vacancies and a high demand on expat nurses. So for any other countries, three main measurements you need to see. First, you need to measure the high schoolers' perception toward nursing profession. Plus, how many are they? In Saudi Arabia, we have more than 350,000 high schoolers graduate every year, nearly 500,000. How many seats available for them? Not more than 5,000 only. Look to the job vacancies. More than 140,000 of jobs left for recruitment missions because there is no sufficient national nurses. So the supply and demand, it's clear to us. So bottleneck here is the academic institutions, which they need to be supported. And that's why the only profession that Samu Sayyidi Wali al-Ahd directly named the mega project, the biggest project in our country by his name, مشروع سمو العهد للتمريض. He understands exactly when we solve the problem of having a challenge in the number of schools, nursing schools, then we can operate more hospitals, and then we can provide better quality of care for our population. Next, please. Okay, the capability. Next, please. So we will talk about how our national nurses are doing currently. Actually, when you see the main challenge in our national nurses is the mostly, like other countries, having more diploma nurses. The diploma nurses currently is nearly 50,000 among 84,000 Saudi nurses. They represent nearly 70%. So you need, if you look to the magnet recognition programs, other indicators, you need to have at least from 70 to 80% BSN prepared nurses. And that's why we have to adapt a project toward bridging current diploma nurses. Next, please. I know I'm out of time. So, meeting with the global directions, I will leave this slides with you or with the conference, so we can just look into what brought us, especially to the last WHO report, the state of nurse and midwifery, and then the global directions, the global strategic directions toward having better nursing workforce. This is actually exactly what I'm trying to bring in this great platform. We have to be aligned with this. So we don't want to be away of the global directions. So I will just present the next slide, which is what was happening during this time in Saudi Arabia. Mainly, we have different royal decree. The cabinet of government start to recognize our nursing challenges. First, most of the colleges were promoted to universities. No more colleges that have a diploma graduates. And again, in 2011, considering the minimum entry level of nursing profession is the bachelor degree. So this is a mandate. We start working on this. And then the healthcare transformation strategy issued by the Ministry of Health in 2018. Another workforce reform strategy issued by the health sector transformation plan. So all of these actually governmental support. Hopefully by 2030, we will have a high or sufficient number and qualified nurses to provide better quality of care. Next, please. So if we will just look at the major move of our country for the realization of the 2030, we will have the importance of strengthening the role of healthcare sectors, either private or governmental. We need to invest in every sector, regardless of the affiliation. We don't want to have any more fragmented healthcare institutions. We have to sit in one table and to share the knowledge to serve our population with better care. Increase the nursing capacity, mentioned. Building nursing capabilities. Develop a national recruitment and retention strategy to sustain the provision of care. Support the development of the National Nursing Benchmark Database, which we're going to, inshallah, discuss in our National Nurse Summit this evening. And establish the national strategy of nursing and midwife workforce. So I think that's all what I have. And we will be so glad to have your questions. And again, thank you for having me here and being with you today to share and get the benefit of our collaboration today. Thank you all.
Great. I'm sure we're going to have a lot of questions around nurses education. Dr. May is here from our college and other scholars as well. And how can we contribute to this transformation in nursing in the kingdom? Can you hear me? Yep, you can. So stick around for our panel discussion. So we discuss all those areas of concern with all our panelists. Now, next I would like to introduce to you a dear friend, Dr. Fatima Rifai. Dr. Fatima was the secretary of the UAE Nursing and Midwifery Council from 2010 to March 2021, and the advisor for nursing affairs for Ministry of Health and Prevention from June 24 to March 2021. Currently, she is a member of the board of directors of the International Council of Nurses, very proud, board member of Emirates Nursing Association ENA, and member of Commission on Magnet ANCC. More than 30 years in leadership role, upgrading and promoting nursing services, education, regulation, and professional identity in UAE. She went through establishing the Federal Department of Nursing, the UAE Nursing and Midwifery Council, and the Emirates Nursing Association. The scope of this included providing strategic directions and support for nursing services, contributing to transforming nursing education from the technical diploma level into the professional bachelor level, building up to the UAE NMC structure, and promoting nursing professional identity and image. We are so proud of you, and we're very happy to have you here.
Can you use this? And here. That works? Yes. And here, this one. Assalamu alaikum wa rahmatullahi wa barakatuh. It is my pleasure and honor to be with you today. So happy to see nursing and nurses in Saudi Arabia progressing so well. Today, in 10 minutes, I'll try to share our experience in UAE, how we developed nursing and how we are continuing to develop nursing in UAE. Thank you for the kind introduction, and thank you for the invitation to this very important conference. UAE, as you know, and you heard, I'm sure, is a country of almost 10 million population right now. And since our founder, Sheikh Zayed, Allah Rahmah, have established the federation, UAE enjoyed vast development in all aspects of UAE development, whether it is education, women empowerment, youth empowerment, cultural, scientific. We have developed cities that are well established right now in UAE, and it shows that the country is empowering youth and women, and we are also kind of emphasizing the happiness of population. Right now we have Minister of Youth, Minister of Happiness, and all this is direction of the country to provide quality living in UAE. So right now in UAE we have 59,000 nurses, and there are 143 hospitals, around 4,968 primary healthcare centers, 63.61 nurses and midwives per 10,000. In 2018, it was estimated that for us to reach 75 nurses per 10,000, we needed 22,000 nurses. So if we look at the current statistics, we are, in general, I think the direction is well, and we're developing workforce to be more to provide healthcare in the country. And in a cross-sectional study, we can see that nurses in UAE are, majority of them from outside the country, trained in many different schools, and basically mainly from Philippines and India, but from maybe around 200 other countries in the world. And in general, our nurses are young, 38% under age of 30 years. All of them, majority of them, very well educated. Approximately 71% are holders of BS in our healthcare setting. So as I am going through what we did in UAE, I will kind of take you through phases. These phases coincide with me being in the healthcare as a nurse. I graduated 79, and I joined the service in UAE 1980. So when I joined, this is from my perspective and experience, education at that time was kind of a simple and primitive stage. We had a School of Nursing that was established in 72, and I joined the School of Nursing as soon as I graduated. And so nursing education was, as I said, kind of just starting. We had entry to education of multiple levels. It could be intermediate, could be just primary. So admission to school of nursing was really not at the quality that will provide quality and strong graduates. Within, as I'm working with my colleagues in the school and meeting some other pioneers in nursing in the country, such as Dr. Amina with us today, at that time, through this forum of education, we're able to contribute to some committees and be members in regional and some international committee. At that time, we have realized that the image of nursing in UAE is quite kind of, let's say, not positive. And the role was not visible, not appreciated, not recognized. And in general, we as a professional, whether UAE nurse leaders or whether even our nurses, expatriate nurses, we felt motivated to give care and to introduce change, but we were not empowered. So during this period, it is characterized by nurses not being visible, not recognized, and they are not engage in decision making at facility level or at even at corporate level. We're fortunate, and I think I am also fortunate, that I was able to contribute to some reforms of education. That was during 1984. We had a team from AUB pioneer in our region in nursing and in education and nursing service. At that time, we have managed to develop the program. It was a diploma program, but we have developed it to make the admission at a higher level and standardized, and we're able to expand nursing education into other emirates. So we opened schools of nursing in 4 other emirates. So that's the kind of the start of the change. At that time, the education, the graduate, having leaders, UAE leaders, and other leaders from around the world have helped us to recognize what to do for nursing. We, as a profession, and also the healthcare system, a time that kind of ready to change. And I think this helped us to move to the second stage, which I called it setting the directions. This is now after 7 years, 8 years of me being in the School of Nursing and of the reform that happened in education in UAE. What happened, I came back from my master program, and I had during my studies this vision of what to do for nursing in UAE. Knowing that the image is not positive as we want, knowing that nursing is not visible, knowing that we are not able to engage and participate, contribute to the decision making. The vision that I shared later on with other leaders in the country and other nurses, that the profession in UAE needed a unit, a central unit that represents nursing for engagement in decision making, professional association for the identity of the profession, and professional regulation where nursing and nurses are defined and are regulated. So here comes the first pillar of foundation to change is the willingness in Ministry of Health to introduce change. And first thing is that they wanted to develop Department of Nursing as a central unit for engaging nursing in decision making and representing nursing. And guess what? I was lucky enough to be nominated to the position of the director of this unit. So I had, the opportunity to bring this vision that I had and I shared with colleagues in the country into reality. So accepted the offer and started building the department with building the team, and we addressed a lot of challenges and needs of nursing in the country, including needing to have a registration system, addressing regulation for nursing. And at that time, 94, we have for the first time established a national nursing strategy. And the highlight, I think, of that period, at 2000, we had the first BSN program to train our nurses, and that was in Sharjah University. So this is now kind of set up the scene for the other step, where we wanted to focus on professional image and identity. So that we have the structure now. We are able to contribute to decision making, able to contribute to the strategy of the country. So how about we focus on the image and identity of nursing in the country. So the efforts with leaders in the country, we have always implemented and always hold the principle of engagement across the profession and with other healthcare providers, our colleagues from other discipline that help us to implement what we want. So the third stage is image building. And here we have developed the association 2003. Development of the association was one of the objectives as the Department of Nursing, because we are as a central unit, we were able to engage nurses around the country successfully. We had the association. Of course, we had a lot of challenges and a lot of dialogues that we have to go through to convince our colleagues, healthcare professionals, our colleagues, doctors, physicians, and other people within Ministry of Health and other healthcare organizations. Very important for the identity of the profession is focusing on developing Emirati nurses because this will provide the role model, will emphasize the positive image for the community about nurses. And we have developed programs nationally, but as well as providing the international possibility and international opportunity for our nurses to develop. And that we have developed the first ICN Leadership for Change program in the region in 2002. And at the same time, in that period, we had focused on patient safety, developed quality champions, and we have trained many nurses to be involved in quality programs. The important for us is also the international recognition. Within 2 years of the work of the association, we managed to be members of ICN. So we put nursing and nursing profession in UAE on the global agenda. And also lately, we are also a member of the ICN board, bringing again the profession not only in UAE, but also in the region on the international agenda. We've been able, because of our work and activities, to contribute to WHO consultation. So this period characterized us by building the image and the visibility of nursing in UAE. We have continuously attended the ICN conferences, and we have been also very active within WHO and other global forums. This period I called it regulation and professional standards, and this coincide with the focus in the country and around the world on patient safety and on importance of regulation. We remember the reports that been generated showing that adverse events and errors within healthcare were killing thousands and thousands of patients. And so this focus also coincide with my my PhD dissertation on patient safety at that time. So when I came back, I thought now it is the time to implement the third pillar. So we had the central unit, and we had the identity, the association, and now we want a body specifically focusing on regulation and standard for nursing. So we had the opportunity to launch the UAE Nursing and Midwifery Council, and we managed to have engaged many nurses And it is, of course, a privilege that we have in the country, that we are multi-nationality, diverse workforce, which bring a lot of background information that help us in developing our own standards and regulatory mechanisms. And then I guess the best thing of this process that also we were able to contribute to the global quality programs such as Magnet, which also puts UAE nursing on the global agenda and global community of nursing. And the development and progressing is continuing. I would say that since 2010, the influence of nursing in UAE been more developed and recognized. In 2013, the government had a retreat to look at the needs of the population in UAE, including healthcare. And we were fortunate, and I think this is a result of our work and our emphasis on including nursing and decision making and contributing to the healthcare system within UAE. We were part of the retreat of the government. This retreat resulted in a very important initiative in the country called Promoting Nursing as an Attractive Profession. It mainly focuses on not only attracting and encouraging young Emirati nurses, which is very important, but also to retain and maintain the nurses that we have in our healthcare system.
Fatima, sorry, Dr. Fatima, please 2 more minutes and you have to finish.
Okay,
Thank you.
So we can go from here. This period is very important for us because it shows that the effort that we have been using all these years have resulted in the nursing profession in UAE to be part of the decision making at different levels. And this is continuity of our progression in UAE. Right now we have a national committee for nursing and midwifery affairs under the leadership of our chief nurse, Dr. Sumaya, and we have a national strategy, and we have a national competency and professional practice framework for education. We've been expanding the nursing education programs. Nursing practice standards is unified, and magnet and pathway of excellence designation is available in the country. Thank you.
Thank you so much. After all impressive and very professional speeches and presentation, I'm looking forward to our bright future. Me and Fatima.
Are we going to proceed with a panel discussion? Very quick, short, smart panel discussion?
Yes.
Okay. Before the Innovation Hub.
Yes. We will be having the panel discussion until 12:30, so that is around 20 minutes of discussion before we do the Innovation Hub and we go for lunch. So I would like to, at this point, invite all the speakers of the morning session on panel 1 on nursing discussion, on nursing excellence, to be on stage now, please. So Maureen.
different perspectives and different angles of nursing excellence and knowing what's going on all the way from US to here in Saudi Arabia and in UAE. Nursing is evolving, and it was so interesting, Dr. Fatima, that you kind of reflected back and looked at all the eras of nursing, and I wish we could all do that, kind of like have a historical perspective of what's happened and where we're going. So I hope that during this panel, I'm on the screen, okay. I hope during this panel we're going to have some ideas about what we have learned and where we're going. And we have our online attendees. Ryan, how many attendees do we have online? 130, great. Yes. So talking about Magnet and talking about what's been going on in the region, I wanted to ask you, Maureen, first. What do you think about all of this which is happening in the Middle East, and did ANCC have this in mind, or how did this all happen, and where do you think this is taking us to?
This is Sam. Yeah.
I think so. Can you start?
Is it on?
Yeah, it is.
Hello?
Yes.
Okay. Can you hear me? Yeah. It might be better. Sorry. Can you hear me now?
Yes.
That's like a U.S. joke, so sorry. Yes, thank you, Joe. It's really exciting to Magnet when we see the concepts that put Magnet in place really grow globally, and it is really much reflected in the new mission and vision for Magnet, and I think this is what we're seeing across the world, is that embracing of really looking at how nurses are contributing to those outcomes that are done in the organization. One thing that we didn't really talk too much about today, we talked about measuring for those outcomes with the empirical outcomes, but we didn't talk about benchmarking and the value of benchmarking. When we talk about, as Rosemary mentioned, looking at that data for nurse engagement, for nurse-sensitive indicators, for patient experience, I remember in the U.S. when we first started measuring those, and I was a clinical nurse still at the time, and thinking, well, of course we're doing well. Why do we have to start submitting this data? We know we're doing good. And then we got the data, we kind of went, we have some opportunities here. So when I look across the world and I see the increase in benchmarking data, I think that that is where the future is, because it really does tell us how we're doing, the importance of the data we're collecting. We can assume we're doing well, things are working, but until we start actually measuring and we start seeing those outcomes, we can't really tell that. So I see that Magnet is really driving that, because even if you're not pursuing Magnet, as we always say, at least put the framework in place. At least live that value and really be looking at data to ensure that you're growing and you're really promoting that excellence.
Amazing. Thank you. That makes a lot of sense to a lot of leaders from the region, I think. We have a question. Perhaps he has a question, and then he disappeared. Oh, here he is. Okay.
Hello, everyone. Thank you for all the wonderful speeches. My question is for Dr. Julia. We are CNS as clinical nurse specialists, and we would like your experience on how clinical nurse specialists influence the journey to Magnet, and what are some of your advices for us?
Will this one work? This one's on, I think. This is better? Okay. So the clinical nurse specialist role was created to be a clinical coach at the bedside, to change evidence-based practice, to develop new programs, and the model that you have at ABUMC for using the clinical nurse specialist has been critical in the growth of the nursing staff there. The challenge that we have worldwide is recognition of different roles. We know that we need to
nurse manager. We know that we need to have clinical staff. But making the business case for why the clinical nurse specialist is a valuable contributor is key to the process. And being able to show the improvement of outcomes as a result of the leadership they provide to change the clinical care, by being able to show reduction in costs by introducing the right products to bring the practice up to date, by being the clinical coach in addition to unit-based educators to change the practices. All of those are important. The challenge I can share in many regions in the United States is that people don't make the business case, or the clinical nurse specialist doesn't fully evolve into that role. And that role requires that you're very comfortable insinuating yourself into situations to which you were not invited. And by doing so, exercise and demonstrate the value of this clinical coach in the workplace, and make yourself an invaluable person that no one ever wants to have to replace. At the present time, we're trying to negotiate with a local university to provide a cohort of learners in our geographical region just to develop dozens of new clinical nurse specialists, because the need to return to the basics on a regular basis and the need to develop new programs is so critical that we want to infuse more of those bodies into the region to help to elevate the practice. So the model you've had for some time has been good. The challenge is continuing to find the programs that can educate them into the role, and then having the leadership support to let them grow and really execute the role.
Helpful? Dr. Nandi, would you like to comment on that? I mean, following up on that question about advanced practice nursing, how do you think that's evolving in the kingdom? And also on the note on certifications, you know, when we have to for nurse certifications in magnet organizations and in the States, it's a very easy process for nurse. I mean, it's not an easy. I mean, they still need to study and sit for an exam. But how can magnet hospitals here in Saudi Arabia meet that standard by elevating the nurses' knowledge, skills, by having certifications or specialty programs for advancement?
Yes, thank you. I think speaking of capacity and capability, and the same thing when we talk about the Saudi nurses, and if we look to the whole nursing workforce, we have a challenge: the retention among nurses within the critical care. It's another challenge. So it's not the challenge is not only having sufficient number of nurses, but retaining them in the first degree, and then having them or upskilling them to the level of critical care nurses. We in Saudi Arabia, and we compare it to other international benchmarks, the highest turnover rate, was after the pandemic. It was in 2020, the opposite. And during 2020 was the highest retention rate. Maybe it's due to international flight lockdown. Maybe because of our commitment, professional commitment to be with the nurses as everyone home quarantined. So it's completely different after 2020. 2021, here and I read in resources, for example, it reached more than 26% of the total nursing workforce. In Saudi Arabia, we reach almost 20% of turnover. So these actually numbers, you need, look again, from a financial perspective, you need to think of it careful. It's not about nursing anymore. It's about two major things. First, patience. Connect yourself with the nurse, with the patients. Everything you do will affect positively or negatively your patient. So also have a high impact on the profit as well. For example, in nursing health, as any other governmental sector, as non-profit organization, it doesn't mean we are a non-profit organization, we don't have to pay attention toward the cost. Cost is a backbone for any healthcare institution regardless of its classification, profit, semi-profit, semi-non-profit, whatever. As you retain your nurse, as you continue upscaling them, you will have better outcomes and sustainable care as well. So I hope I answer your question.
Thank you. Yeah. And on the topic of nurse-sensitive indicators, we're also going to be having, I think, around like 45 minutes of discussion of Nurse Leaders Summit on the database which is being developed now in the kingdom for nurse-sensitive indicators. So that's going to be an interesting discussion as well in the evening.
Yes, actually, it's good to remind me. Again, during the patient experience worldwide. Actually, in our National Health Command Center, it's national health anymore. It's health. It's shared body by all the healthcare institutions, private or governmental. We will start measuring starting 2023. All the nurse-sensitive indicators.
Technical problems, but I think let's just turn these off, all of them, and we'll just go with this.
We have already established 11 indicators, including the patient falls, pressure injuries, cavity, collapse, etc. The safety, we call safety indicators. In addition to the operational structural indicators, like the number of nurses per 100,000 population. Vacancy, job vacancies, another indicator. It's now being measured in the National Health Command Center and Ministry of Health, included only the Ministry of Health institutions. But starting next, we started 2023. We gonna include all the governmental and private sector. So going back to Presgani, also patient experience, specifically the patient satisfaction toward nursing care. The first time it's a national-wide measured, and there is a ticketing system. Once you have, for example, the threshold, you jump to a red zone, you will have a ticket to your institution to put your corrective actions. So it's a huge transformation. Hopefully, all we have you in our command center, and specifically the Nurse Operations Center. And hopefully we'll see better improvements toward patient outcomes.
Very exciting. Very, very exciting. That's going to be a game changer, having the database for nurse-sensitive indicators. Great. Any questions that I can take? Yes.
Assalamu alaikum. Good afternoon, all. We have the honor to have you today. This is Shabab Al-Ataybi, the Chief Nursing Officer, Saudi German Hospital, Dammam, and we are in the journey of Magnet. I have a question to Dr. Muhammad and Dr. Maureen. We are here in Saudi Arabia. We are looking for a big transformation in nursing profession. And as we see from Rose, that she started the journey to Magnet since 15 years ago. It seems to be an isolated case the success or the story of Magnet Journey. That in the kingdom we have only King Faisal Specialist Hospital and King Fahad Specialist Hospital in Dammam. So is there any partnership or cooperations between Magnet and Saudi nursing associations or Saudi nursing leadership in the Ministry of Health? Because we want to share the experience to make it a global concept and to apply Magnet concept or an excellence in nursing, as we see in other profession. When we look at CAP or AA, WBB, or JCI, it's a global concept of accreditation, implementation of excellence. So what was the futures, or there is any partnership between Magnet and Nursing Association in the kingdom?
Okay, before passing the Shabab question, actually nothing yet, but we hopefully provide our Nurses Association efforts and capability to any global international collaboration, specifically when we talk about patient care and nursing indicators. I agree with you, further collaboration need to be executed, and we are absolutely pleasured and pleased to have such collaboration. So I will pass it for you. Thank you.
Now, I agree 100% that while there might not be a direct collaboration or partnership, what we know is nursing associations, wherever they are in the world, are committed to nursing excellence, the same as it is for Magnet. You know, it's about having the same goals in mind, that you have nurse engagement, retention of nurses, patient outcomes are successful, and decreasing costs, all of those things. We all have that same end in mind.
Thank you so much for positively commenting on that question. Shabab, good question. Jeanette, Rosemary.
I'm sorry. Go ahead, Jeanette. You go first. I have a comment, but go ahead first, Jeanette.
So I think that was an incredibly important question that was just asked. And I think for the Magnet Commission, as we keep looking at the standards, we are always asking ourselves the relevancy of those standards to nurses around the world. You know, what started as, if you will, a 41 cohort organizations that were Magnet, we now are an international organization. And so for us, ensuring that these standards are applicable to nurses wherever nurses are practicing is important. And I would also add that the ANCC really values the international voice, and why, in fact, 2 commissioners are from the international arena. So I agree that we need to keep the focus on the work of nurses around the world and that alignment towards nursing excellence, no matter where nurses practice.
Nursing everywhere. Thank you, Jeanette. It must be very, very early where you are, or very late. I don't know. What's the time over there?
It's very early. I've just made strong coffee.
Thanks for staying with us, Jeanette. And Rosemary had her hand up. So Rosemary,
Yeah.
please join us.
So thank you very much. And so, you know, again, thank you to the question that was raised, and certainly agree with the comments made by both Maureen and, Jeanette. And so I would say is that while there might not be that strong collaboration at the association level, you know, as we look at the Magnet vision and what our accountability as an organization that's Magnet is it to be, and we reach out, you know, fountain of knowledge, reaching out, supporting our colleagues. We get calls, we meet up at conferences. We actually, when someone comes and pays us a visit, we, actually kind of set up, an opportunity for our Magnet program director to maybe come and do a site visit with them. We can't, be their consultant, but we will, make those linkages, those contacts, go do some presentations at other organizations. And I think that, probably those who are on the panel here today who our, magnet organizations, magnet CNOs, we look for those opportunities to share our learnings, also to learn from other organizations, and again, keep that momentum going. I wanted to add one other comment too. You sort of broke up a little bit earlier, Hara, with your question. I heard some comment around advanced practice nursing, so I wanted to comment about that. And so, especially with the transformation within the kingdom, 2030 vision, the advanced practice nurse model that we have, in other parts of the world is very, it's very strong, embedded to our practice. And I'll speak from the United States because that's where I'm from. But, in particular, we've had nurse practitioners, advanced practice nurses for numerous years. And so we know the data shows us that the patient experience, improves, with, that the nursing involvement. And I believe it includes not just the registered, bedside nurse, the clinical nurse, but it is our advanced practice nurses. So I'm delighted to say, I'm happy to, if anybody wants to reach out as far as what we've done here at the King Faisal, is that we have probably about, I think, almost 12 advanced practice nurses now that are master's degree, either board certified or board eligible. We work with, very closely with one of the universities in the kingdom, as well as universities in the United States, to send our scholars to. I've got about another dozen that we've interviewed that we hope to be bringing on fairly soon. And the limitation with regards to licensure, is that, we don't see it as a limitation. In our organization, we have developed a policy, a credentialing and privileging process. We run our advanced practice nurses through the credentialing and privileging committee for the organization. So we hold rigorous, standards. We work very closely. And, again, there's a physician, supervisor that proposes those particular, privileges that the nurse practitioner should have. So we've got a pretty rigorous process. Happy to share that. And, again, it is part of the transformation here. We're really looking forward to, developing a fellowship for our advanced practice nurses that we can, be, certainly an organization that nurse practitioners can come to solidify their practice after their, master's degree program. So I would also add too, is that, we've had a 15-year journey. I omitted to say that, our hospital in Jeddah, the King Faisal Special Hospital and Research Center in Jeddah, had a 16-year journey. They were designated in 2014, and they could have even started, earlier than that 16 years. But, again, we're very open to, any, partnerships, collaborations, any way we can help any organization. Please reach out to us. And again, delighted to be here today. Thank you.
All of that, licensure, privileging, credentialing process, we would love to learn from you and see, what are the challenges and how can we go through those together. Thanks, Rosemary.
Thank you. If I can make one more comment here, I don't want to take too much time here, but I think academic practice partnerships are key and critical to any organization, especially on the magnet journey. But we partnered with Princess Noor University, and again, early on, when they wanted students, they wanted to have 10 students do their rotations here. We said, absolutely. They did rotations. And at the end of the year, they said, we'd like to place another 10. And I said, well, we'd like 20. And so our focus was really to bring on, as many as we could to run through for their, clinical practicums, and then potentially make them offers, right? And so, those clinical placements are opportunities for us, unless they're already committed to another organization. We do our best to observe them during the time that they're with us and identify individuals who we could certainly attract to our practice. So I think academic practice partnerships are key and critical to all the work that we do, but especially with regards to, our, advanced practice nursing and increasing the number of Saudi nurses we have in our organization. Thank you.
Thank you. Thanks, Rosemary. Again, and is our time, is it over? Okay.
Yes.
We're just gonna,
We have to finish now.
I'm the organizer of the 3 more minutes. I want to take a comment from Dr. May on that note, I think. Don't worry, we will get there. We will give them less time to eat.
Okay.
Sure. This is more important.
Fair enough.
Yeah.
Okay.
Is everyone okay with less time to eat and more time to talk? Yeah, there you go.
Yeah, thanks a lot for all the presenters. It's very valuable, actually. I am May Al-Khanezi, Almoosa College of Nursing, of Health Sciences, but it's basically nursing to start with. It's actually probably comment and question. During the breakout session, I had the chance to speak to Dr. Maureen about education and magnet. So my question to all the panelists, how can I better prepare my students to be ready to be in a magnet environment? What is the student that you are looking for after graduation, and you will say, aha, excellent, this is the ideal starting nurse at my institution. So this is the first question. The second question, are there specific competencies related to not only magnet, but for graduating students to start at your reputable institutions? What are the main things you are looking for? Now, because we always talk about, for example, magnet, person-centered care, patient experience, themes that are at hospital and institution levels. How can I, at educational level, better prepare my student to be ready for you? Not only ready for you 5 years from now, or 10 years from now, not now. I want my student to be better prepared than what you expect. So how can we look at that?
I'm going to give this question. Is there a specific person?
It's for the panelists.
To give this question to Majida, because she's been, she's received students.
Ito mga guest din.
What are you
Yung mga
looking
guest.
from the nurses?
Thank you so much, Doctora, for this question. In fact, I will tell you something that when I started the journey, because the average age of the nurses in Jordan actually is 26 to 29 years old, so we really have very young nurses. We have many nursing schools in Jordan, and we felt, wow, we don't have experience. But what I realized
Ang life school niya, sa mga student niya.
that they are really with some education and development, they are ready and they wanted it and they are ready to fly. Just they need some sort of education and mentorship, and they are really, really ready to take it and to go. So if we go back to the education in the university, actually we have, years back we have some sort of meetings with the people from the academia, especially that I have some academic contribution, and we asked them about, please introduce the concepts of patient safety goals, the accreditation, the safety issues, quality issues in the curriculum. And they did. We started to see the results, that the nurses, they came out from school, they know some of the major concepts that we are looking for into the organizations. It is the same for the other stuff, like autonomous practice. And sometimes I see the nurses graduate from the school, and they have some sort of autonomous practice. I don't know why when they come to work in hospitals, they start to, pulling themselves a little bit away. Maybe it's they are afraid from the reality, or there is a human being we are taking care of. So really we have to follow instructions and be 100% compliant. But teaching them in the universities how to practice autonomy, and that as a nurses they have some of the autonomous practice that no one else if they don't do it, no one else can do it on their behalf, or no one else can teach them how to do it. So introduce the concept of shared governance, introduce the concept of autonomous practice, and we have a very successful experience in Jordan that now almost 3 universities, they are inviting me like for the 4th year student or the master preparative student to give like courses about the shared governance, how to think about patient outcome, patient experience, patient-centered care. It's very important. It's very important to introduce these concepts preschool. We have another experience that we have what we call the internship program. We have the 4th year student, and coming to our hospital, we train them for free. So they live the environment. They stayed with us around 4 months, so they know what's going on, how to work with their colleagues, and how to learn how to be an excellent nurse, not just an ordinary nurse coming do the work and leave home. So it's really multidimensional, but the key for success is introducing these concepts very early into the school and let them practice it. When they go for training, let them do the action plan autonomously, let them speak about it, let them talk, think about patient experience, all of these things. So early on, I think this will be very good.
Can I add something, Ms. Hera, if you may allow?
Go ahead.
I always believe that all of us, as graduated nurses, we are responsible, accountable to inspire the future nurses. I always keep in my mind that each nurse stands up for herself, she stands up for all nurses. So I'm responsible, I am Fatima, responsible to educate, to inspire, to empower all nurses who's just thinking to enter the community of nurses, the family of nursing profession. So it's my responsibility, it's your responsibility, not only our leaders.
Well, I think we can always continue our discussions. We have plenty of time for breaks and during the innovation hub as well. So I'm sorry if we couldn't take more questions, but if there's anyone who would like to add anything from the panel, Rosemary. Yes.
Yeah. Go ahead, Jeanette. I think your hand was up first. I'll keep mine brief, but go ahead. You go first, Jeanette.
So I think that was another very important question about starting Magnet in the schools. And it's not Magnet, it's the values associated with Magnet. It's the underlying principles. I happen to have been in graduate school when the Magnet Hospital study, the original study, was published. And my teacher was Muriel Poulin, one of the original researchers. We had embedded in us the value, all of the shared decision-making, accountability, the importance of measuring outcomes. In my class, the majority of the graduates from Boston University, from Muriel Poulin's class, became chief nursing officers. And every one of us went on the Magnet journey because of embedding the value in our program. So I think the woman who asked that important question is spot on, that no matter where we're leading, where we're practicing, nursing excellence is incredibly important.
Thank you, Jeanette. Thank you for that comment. Thank you. Rosemary.
Yes, I would certainly echo what Jeanette said. I certainly did not have that same privilege, but I can see, well done to the impact of that teacher, that professor that you had in your graduate program. So I think back to the questioner, what I would suggest too is that work very close with your academic partners. And so we talk about academic practice partnerships because it's bi-directional. So I, as a practice environment, I can inform academia, right, of what we need in our nurses to be successful at our organization. Likewise, they can keep me updated on what things are different in the curriculum that I need to be aware of at the organization. But I have to say, first and foremost, what we've done here at the King Faisal, and I would suggest that in your instances, consider as well, is that, we have, interns that are with us for 1 year. And so we have students who come to us in their 4th year, and we also have summer volunteers. And so if they are our new graduates, they're our employees, but the others are not. And we work very closely with our academic partners to say, we have these great prevalence surveys that we do. And several years back, we switched from quarterly prevalence surveys, for not just, not just pressure injury, but, restraints, all, ID bans, all kinds of things. We do it monthly because we found that kind of, that extra effort, that find and fix, we continue to be able to kind of tweak and improve our outcomes. So in that regard is that we, in those, monthly prevalence surveys, we include our, not just new graduates, we include our interns who are still in the university, but just with us for a year. And they have a specific curriculum they have to follow, but we work with our, academic partners to say is that we'd like to include them on these committees that will be very helpful in their, academic progress, but also in joining our institution. So, we just don't want to have all of the students or all of the interns doing our surveys, but it's a nice mix. So we include obviously our new graduates as well as our experienced nurses, our interns, our students, and our summer volunteers with individuals. So I think there's nothing that's top secret about any of that. Likewise, your UBCs, your unit-based councils, or any councils, it's not top secret. Invite your interns, invite your students to those, sessions so they can observe the practice of nursing and how nurses are, exercising their autonomy, their voice, and really just, being part of the practice of making those decisions. So that's what I would suggest that you might want to consider, but thank you very much.
Thank you, Rosemary. Thank you. There's one question I'm going to take from the audience, and that's going to be the last question.
Okay, thank you.
So this one says, do magnet hospitals, does the retention rate in magnet hospitals, does it increase or decrease? Is it better or worse? I'll give you this, Julia. I know it's a no-brainer.
Well, you'd like to think it's a no-brainer. Ideally, it will increase retention of nurses not only to your facility but to the profession. And if we do the right job with growth, they may move to another facility with the same kinds of values. And so while we can look at Magnet as an individual achievement, again, it's a team achievement, and we want to support all kinds of organizations. So populating our facilities that are not yet Magnet with our Magnet leaders, whether they be frontline nurses or the formal leadership, is critical to the growth of the profession and the value that the profession is seen by all of the other disciplines.
Julia, you spoke about the research behind magnet as well, and that goes well with what you said. But also, is it now? Is it a stamp? Is it an added accreditation? Is it something, a luxury people might hope to be a magnet hospital?
Sure. So for the first part, we know from the data from research pre-COVID that absolutely magnet hospitals have higher retention rates. Now, what we don't know is COVID, that time period. But to your question, Hera, is very much about, again, not having the data available yet, but what we've heard when we do a focus group, and we've done several focus groups within the Magnet program, is that the organizations who are Magnet or are actively working towards Magnet are, and I would say more mature in their work towards Magnet, have absolutely reported that they had a stronger response to what's been happening, again, worldwide. Nobody went without impact. That they had that structure and process in place that made them stronger. And so they feel, again, I'm using a feel word instead of a measurement word. So it's a little soft, I will admit that. But what we have heard is that they think that this is what has made them successful through COVID, what gave their power to get through COVID and have not been, had some of the same attrition rate, some of the same nurse dissatisfiers that other organizations have had. Again, very much qualitative and not measured.
So, Maureen, I would add that through many of the exemplars over the past year have in fact, and this is global, not just US, that many of the really exemplary practices that we saw were the way in which Magnet hospitals kept nurses safe during the pandemic. So in fact, that's a retention strategy. But also as the workload increased due to the severity of illness of patients with COVID, many Magnet organizations really created ways in which to redeploy nurses from specialty areas to COVID units, and they were really best in class. So while again, it's the narrative, but we did witness that throughout all of the organizations that were designated initial or redesignated organizations. It was best practice. So those are retention strategies, in fact.
Thank you so very much for every single one of you to be part of this wonderful morning and discussion.
Shall we?
Thank you so much.
Thanks a
Thank
lot.
you all.
Thank you.
What's now proved was once only imagined. Advanced technologies, innovations, research, transition from theory to practice, and a wider vision to nursing future.
So we are now very pleased to invite you, along with Ms. Hera, to open the Innovation Hub and to sign the Memorandum of Understanding, followed by the lunch, finally, will take place at the back of the Innovation Hub. And you can turn back here at 2:10. 1:45,
Okay.
we need to sign. Okay, 1:45 sharp, please.
Okay.
Thank you so much.
Thank you.
Cantu.
ما إن
اللي بنهار بينا هون. يلا. خلنا نتفل.
It's okay. No, it's okay. Hello. Good morning. How are you? Thank you. You too. A mentor for us because of Miss Alik, because she kept on talking about you for us. So I feel like I know you very much, and I'm so proud to meet you in present. Yeah. So. No need to tell us anything. Listen and go. Okay, and they are very pleased to do so. Thank you. حبيبي no. Thank you. تسلم تسلم. وباي ذا presentation has هيك left us إنه wow
Thank you, Dr. Mohammed. So I'll be introducing. I'm not good in Android. Okay, I'm good. It's my pleasure to introduce our next speaker, Dr. Ilham Al-Atiq. Dr. Ilham is a very known leader. She has over 25 years of experience. She's passionate and committed to leading changes and development of nurses to advance nursing profession in Saudi Arabia. Dr. Ilham is a past academic dean of 2 nursing colleges in Saudi Arabia, and she's an active member of many institution advisory programs and has several experiences in international and national level. She received many recognition from different institutions, and lately she was awarded the Arab Women Distinguished Award for the year 2021. Currently, she's the Chief Nursing Officer in MHC Mecca Healthcare. She works as a collaborative partner, not only ensures the advancement on an agenda of change, but also enhances communication and provide an opportunity for development of key individuals on the executive team. Dr. Ilham, welcome on stage.
السلام عليكم ورحمة الله وبركاته والصلاة والسلام على سيدنا محمد وعلى آله وصحبه وسلم. First of all, thank you very much for this very special day, honestly. They say ilham in Arabic, it's the meaning of inspiration, but actually today this connections, this conference kept me inspired very much with all the talk that's been there. I'm very honored really to be here and to see the vision that Mr. Malik previously spoke about in 2017 when we were in Eastern Province with a lot of my colleagues. He was envisioning the nursing college, and now it's Magnet Nursing College. I'm very happy, and congratulations for all of you. This is really a very important milestones. The passion that is witnessed in this auditorium testify for how nursing in private is moving very fast. Allow me today to share with you, I have only 10 minutes, and I'll promise most of the time I don't stick to my presentation, but I'll do my best. So what I'm gonna, let's start. Today I'm gonna talk about the system chief of nursing, the role in clusters, which now I have been, blessed, honored, trusted to have served at Mecca Healthcare Cluster as the Vice President, in a Vice President position. Next. No, that's the old one. It's okay. Okay, so today my introduction, I just put some pictures, but it seems to be the pictures are not there. Those pictures, one of them, it says it was the picture of Mecca and some very of the historical places in Mecca that, I wanted you all, which everybody is familiar and connected to it. And I have started always my presentation in one saying from Quran, قُلْ وَعْمَلُوا إِنَّ اللَّهَ سَيَوْفَ يَرَى عَمَلَكُمْ. And I love this start because it implies in Arabic, it says it's about the intent. And to me, honestly, I've been tested every single day with this intent in the leadership, in the post that I took, in that move in Mecca. And that's been my own saying, the intent and our intent. This is Mecca. I choose to start. This is here when you see the team, the champions, the nurses, and they are above 100 nurses that has been built in 3 years. And as you see here, that's the mountain of Jabal al-Nur, very spiritual place where lots of pilgrims come from all over the world to this place. What I wanted, when we are talking about the inspiring presentation about resilience in Lebanon, and I was very touched by that. What I've experienced in Mecca, very resilient nurses, when they get overwhelmed with so many challenges, Hajj, Umrah, serving, we go and visit Haram and we feed the pigeons. And really, we get that energy back, the resilience. So that's what I wanted to share with you, that, my exposure in working with Mecca nurses. Mecca, have its uniqueness. We have 3 in Mecca cluster. We have 3 specialized hospital and 8 general hospital. We're responsible for almost 6,000 nurses and 3,300 almost physicians, and the bed till this present 2,694 bed, 82 healthcare centers, and per the statistic for the total visitors for Mecca region in 2020 was 17.5 million. But the latest statistic now, with opening the Umrah, it is 2 million per month from the visitors. And that's put a big challenge on nurses, clinicians, health providers, and so many, in this area that have a population of 2.5 million. Why we need to change? We are moving, as we know, to accountable care organization. We're looking at value of care to survive and thrive in the new care environments. We're moving in the Ministry of Health to well-known, recommended 4 aims. The quadruple aim: population health outcomes, better individual patient care experience, and lowering the cost, high satisfaction for both employee and patients. As well, change management and the leadership, we're looking at building the leadership capacity. And this transformation had started in 2017, and it's continued, where we have seen a lot of changes in healthcare. And still we have a long way to go. But the model of care that's been developed from variety of experiences with consultants, it have been really based on the best practices worldwide from the West, from a lot of global, consultant that worked on this to make it happen for the changes. Very ambitious to look at our structure and how we're gonna be moving, and this is really implies to the role of the nurses in this such system. And little is really known how we prepare our nurses in Saudi Arabia to work, not only nurses, the clinician, and how we can move away from the traditional centric structure to the integrated care, where it's all about systems. How we meet this vision in 2030, and how we can, here is the challenge. So, I looked at, this is an introduction, if we just recall the 4 messages that provided the blueprint for the future of nursing, that nurses should achieve higher level of education. Nurses are full partners with physicians and other healthcare professionals, and this is what will allow us to move forward in the model of care, in implementing the vision and achieving accountable care organization. This is very important as well. At the system level, Chief of Nursing Executive or Chief of Nursing Officers, there has been 3 focused areas. And to be honest, I think we have achieved in cluster the focus area 1 and focus area 3. The role of advanced nursing practice, it's there. Yes, maybe we don't have the accreditation, but it is there on more than one level and more than one cluster, although we still have a bunch of them, but the role is activated because advanced nursing practice is so important for moving forward in healthcare. What we are really struggling is the focused area 2, where we want to bring the interdisciplinary team together and moving from the silos and all our traditional way to go back to the main purposes and to the main important thing that all as a healthcare provider we want to achieve. And sometimes it sounds very difficult, but at the same time it is why we have joined this profession, and it is the core. And sometimes we do really, that's talking about what I have learned. We have to really remind ourselves. It's sometimes simpler than we think, that in the end, all of us are there to look at the best interest of the patient, to provide patient-centered care, to care. It's about all, that concept. And to be honest, it's very empowering for me as a leader to witness this with working in Mecca, and to learn this, and to learn from the nurses that has been really working on Hajj, on Umrah, on disasters. It's amazing. They have developed that resilience, and they share with you wealth of that exposure, where the interdisciplinary clinician, they jump into situation and they complete each other. But the only thing, we should carry it. I've always told them, I wish all the year is Hajj, because only at that 10 days, the title is gone, everybody is there, everybody's on the ground, and that's what reminds us this is what we're trying to do and achieve in healthcare. I don't want to prolong my presentation. I don't know how much I have still, but I will skip about there's how to guide the cluster into sustainable ACO, and looking at not only our nurse leader, the stakeholders. What does stakeholders expect from nursing? Where do you want to invest in nursing? Still there's a lot of ambiguity in terms of, there is not right or wrong, but still there is ambiguity about the role of nurses on a system level. These are the contributions that nurses may do, and already we are doing in clusters, and it goes step by step, where we look at the gaps. We have an ACO, accountable care organization playbook, and we look at aligning the initiative. When we started in the cluster in Mecca, it was COVID, and we have also per the requirement to deliver also transformation. So it was COVID, transformation, and we have to come up with the plans at the same time. What we did, we adapted Magnet in model as our framework for the initiative of excellence, the initiative that we proposed, and it was around, in 3 years, it started with 12 initiatives, 12 projects under 3 initiatives, and we ended up with achieving 22 projects in 3 years. I will share with you the system level shared governance that we tried, and we're still learning. We brought it, of course, none of those hospitals have even shared governors, even professional practice model, but we looked at adapting the concept and using it to really implement transformation. How we can get the leadership on the ground. How can we work on the ground, grassroots? And this is where we have formulated the picture that I show you, the 100 champions, and we call them nursing excellence champions. And we adapted this all from the model of Magnet. This is how we started. And every year we are growing, but this is how we achieved standardization in terms of professional practice. looking at quality and patient safety, even in the COVID, how we achieved, in the nursing practice and the operation, a lot of the manuals, the team approaches. So it was all done through these committees. If you see here, each committee, each council have at least 12 to 14 members. So in total, they're above 100. And all of them, we join them in one group where they are with us and they are our partner in the implementations. So, those are the councils. Lessons learned. Through adopting a system-wide shared governance, we get connected. A lot of the walls were not there. Really just being together in that platform, it was, a learning experience for everyone, involving myself. And it's been like, especially at the COVID, but it break the silos, and it took time to break that and build the trust. And the communication was like, much better, where people approach each other. If they don't know something, they want to ask about any kind of practices, it was like a forum. And it was very healthy, and nurses felt that they had a voice, they can make a difference, and it provided a platform for mentoring of new nurses. And it happened through the timing. Some of the outcomes, all our initiatives were very, we were able to align it with the mission and vision for the transformation and for Mecca. Nurses were the first workforce to do strategy and align, and we enhanced the professional competencies, we built capability, even we have developed the skills that is needed in transformation, such as project management, data management, all those kind of skills that they really needed. This is the initiatives, and we had to do it with no budget. Those initiatives were put in a budget, but unfortunately, we didn't progress to get the budget. So it was 6. The number of initiatives was 6. The project were 22 projects. And we have achieved so far 12 completed with high deliverables, and we are almost 75% on the remaining 10 projects. Our approach was, as I mentioned, bottom up, and there is a challenge in using the bottom up, top-bottom approaches, because everybody's have expectation, and they expect from you to fit in that traditional way of leading, and it takes time to see that the other way of leading it, and now with not only in nursing, in so many aspects, in healthcare and in the VRO office. So it's have to do with a lot of collaboration, openness, transparency, engagement, and these are, so many sessions, everybody was engaged. We work very collaboratively with most of our projects. For example, our residency project is in collaboration with academy, with the human resources. So we try as nurses. We don't do it, we take it alone. We join, the physicians, the health worker, other sector to achieve our goal, and it's really been very positive so far in achieving what we do. And to be honest, without the commitment and the champions and the input and the learning and the support of the CEOs, the clusters, everybody, it takes all of them to make, to get to see result in a short time. Thank you so much. I hope I didn't take much of your time. Thank you.
Thank you, Dr. Ilham. Amazing speech from an amazing leader. I don't know how you do it. You are a previous academician, dean of a college, then a CNO in the most critical area in Saudi Arabia, Mecca, in COVID area. So that was a great experience. Thank you very much. Our next speaker is from the private section this time. It's my honor to introduce Dr. Hiba Al-Madar. Dr. Hiba is a healthcare leader with over 22 years of a unique blend of progressive healthcare experience with a proven record of creating agile culture, driving change and leading diverse interdisciplinary team within complex projects to achieve organizational strategic goals. Dr. Hiba in 2017, she successfully completed a doctorate degree in nursing practice from Johns Hopkins in the US. Currently, she is appointed as Deputy CEO of Dr. Sulaiman Al-Faqih Hospital in Riyadh. Welcome, Dr. Hiba.
Thank you for the lovely introduction. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm so honored and humbled to be with you today and being a part of this great event that are gathering under one place, great healthcare leadership and great nursing leadership. And I really thank Hera and Almoosa Hospital for inviting me to be with you today. The first time I spoke with Hera about this conference, I told her I have two topics that I'm so passionate about. First is the healthcare, nursing influence in healthcare transformation. And the second one is my passion about preparing the future nursing leaders. I think there are shortage of executive leaders, either on the level of nursing, medical, CMOs, and CEOs. And as our healthcare organizational numbers are increasing in the kingdom, I think we need to pay attention to prepare executive skills among nurses to be able to help with the transformation. So it's lovely to see that we are all thinking alike. It started with Dr. Muhammad Al-Ghamdi sharing some information that I'll be re-sharing as an introduction to my presentation. I've missed some presentation, but again, speaking about nursing empowership, magnet journey, as well as the involvement of clusters in creating a new leadership and how we are moving with accountable care. So, touching base in Vision 2030, what are we trying to achieve, all of us as healthcare leaders? And in the Vision 2030. So basically, in Kingdom, we want to offer a fulfilling, healthy lifestyle. We want to have a thriving economy, vibrant society, and ambitious nation. Healthcare transformation program among all the programs that are helping to achieve this ambitious vision. As has been spoken by my colleague, Dr. Muhammad Al-Ghamdi, there are multiple challenges that the kingdom is currently facing. First, the aging population or the change in the age of our population. So we used to have much younger population. Now it's going to move into the middle age, and it comes with its own diseases that we need to focus on. We're also having a growing population. The vision for Riyadh, for example, and increasing the number of population in Riyadh requires more healthcare organization to be able to provide the care for those population. Moreover, the change in population in terms of more private sector participant and more health insurance penetration in both government and non-government society. Moreover, we need to focus on how our consumers' incomes and its impact and how they consume healthcare and what's that impact on their lifestyle. So as you see, we have a good number of expats that makes our population Saudi Arabia. We have kind of equal proportion of male and female, and our health population are actually more concentrated in East, Middle, and some part of the West. As you see, our population is going to have more middle age, so we will have fatty waste comparing to what we were in 2000. So we'll have less younger population, more middle, and more aging population. There is still a concern about healthcare expenditure, and knowing the financial part as a competency related to healthcare leadership is as important as knowing the leadership and the clinical care to be able to really contribute. The CEO themselves or the CMOs or the CFOs cannot do it alone without the involvement of all the clinical leaders to be able to really have a focus attention in our expenses and how we provide a value-based healthcare on our day-to-day practice as nurses. Moreover, recently CHI has enforced that government hospitals are also included. So for emergency care that are admitted to government hospital, they should be refunded from insurance companies. That requires nurses who works in semi-private or non-private organization to learn more about RCM, to understand the process of care and how the refund eventually will be able to be done in a way that is more cost effective, and it really requires different way of thinking. So our stakeholders dynamic and access to care and pricing requires a new skills for healthcare leaders and specifically nurses to be able to contribute. And we spoke already about the change in population. Moreover, there is a huge drive into privatization of current semi-government as well as government hospitals, which also requires a new dynamics, a new way of approaching our healthcare practice. So basically, 4 important targets that health sector transformation is trying to do. Facilitating access to healthcare services, so number of healthcare organizations, as well as model of care related to acute and chronic healthcare. Improving the quality and efficiency of healthcare services. So we cannot claim that we are doing high quality care when we don't have the data. When we don't have database that show how we manage our diseases in the kingdom, especially for those chronic diseases that we are currently doing. And that cannot be done without being also efficient in terms of our expenses. You could bring all the technologies, you could bring a huge number of nurses, and you claim that you are providing quality. But in such era of healthcare transformation, we need to be efficient and really provide the quality at the same time, the value of the quality that is combined with efficient healthcare services. And then further is promoting or preventing health risks, that's the kingdom, as well as the traffic safety. There are 4 areas that's currently challenging that the healthcare holding company, the FAB, and all the organizations that in the kingdom are trying to put huge efforts to focus on those. One is the financial stabilities of healthcare systems, public health, workforce size, and also capabilities. So yes, we could focus on a graduate number of nurses, we could focus on more advanced nursing practice, and so on. But we should not focus only in the numbers, but also on the capabilities. So how we can really have advanced practice nurse practice to their full potential. How we can make nursing leaders work hand in hand with their healthcare leaders to contribute to this transformation. And of course, effective delivery of a quality healthcare. So again, I love the alignment between our thoughts. So this is the Institute of Medicine report that spoke about nursing participation during the health reform in the States. And they said that nurses will not be able to contribute if they don't practice to the full extent of their education, if they do not achieve a higher level of education and training that improve the education system. And nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare. And I'll stop here. Redesigning healthcare requires huge influence and involvement in making the policies. it's really at the level of the policies that we should be involved in terms of licenses, in terms of how we contribute, how we should design the patient journey, and so on. And if we are not involved at that level, our contribution will continue and influence in much a smaller level that we will not really have the influence that we all dream of. Effective workforce planning, as we all have wish lists about how many nurses we want to recruit. We all want all kinds of specialties, but at the same time, it's our job to plan those workforce, to be able to do cross-training, to ensure that our members are well prepared for shortage, because we will be all faced with shortage. And if we are not prepared and utilize our resources effectively and use the technology to ensure that we are efficient in our care, and again, data collection not only related to diseases, but also how efficient and effective we are, how we spend our day, and how we could maximize the workforce that we currently have, because that's reality, and we should really deal with reality. As a clinical nurse specialist myself, my master was advanced nursing practice. I actually studied doctor of nursing practice, so it's not the typical or the PhD that my colleagues have. I think each has a contribution, and each has a role in our and how this contribute. But definitely, when you reach to your highest education of nursing, you will be able to, as the leaders, well prepared to involve the system, so such as the clusters and the national level. You need to collaborate more with your colleagues, either clinical or non-clinical. So that's the interprofessional collaboration. And then you influence the evidence-based practice of clinical care and protocols that you provide daily to your patients, and eventually have the databases that reflects your value-based healthcare. Definitely, nurses will not be able to influence if they don't have the skills for healthcare policy, as well as the ability of advanced practice nurses to contribute to the clinical prevention and population health. We are also an era for information technology, and each one of us as healthcare leaders, not only nurses, should master the skills and see how this contribute to our patient care, and how we can reach to patients even in their home and engage them to be able to keep the healthy lifestyles through technology and through effective communication and documentation. So I've used this recently in some of my speeches, but I really call all the healthcare leaders, and specifically nursing leaders, to help in doing a national level preparedness of executive nurses. And I think it really needs, with the number of hospitals and number of the organizations that is going to happen in the kingdom, if we don't put hand in hand and prepare our future leaders, I think we'll have a huge shortage in terms of nursing leadership. So I call for a national program that looks at high potential and selection of succession planning. We need to partner with all the current national initiatives, that is like the Healthcare Leadership Academy, MESC, and all those organizations, to have a focus programs that's focused on nurses. And then we need to have a mentorship program. We all learned academia, we practice at the bedside, but if we don't have that mentor who already experienced being a healthcare leader and really experience financial statements, how a strategy is being done, how the manpower is being planned, all the lesson learned that we learned it ourselves. I think it's very important that we do a mentorship program, and Shabab was talking about the magnet experience, for example. If we are not generous enough, I think many of us, as we accomplished our career goals, it's really the time to give back to the nation of the kingdom, and to really prepare the new generation of healthcare leaders, and specifically nurses, and be open for this mentorship program, that we share our experiences and we really give this time of our day to build those future leaders. And I think I really see lots of candidates that could contribute to this and share this wealth of experience to the next generation. I've used this as the American executive leadership competency just to highlight on the business skills that is truly needed in any healthcare leader. You could have the behavior and the soft skill as a leader. You could have the relationship management. But if you don't have the business skills of the financial management, human resources, driving change and really driving change at the system and organizational level, this is the type of nursing leaders that we all, I think, dream of and really want to pass this knowledge to our next generation and continue to build our skills ourselves. And life is a huge learning experience that keeps going. And I think all of us will keep building on those competencies, but it's also our humble responsibility to share what we've learned so far to our next generation. And I think all success stories start with a vision and successful visions. And I think we all have all the means currently with the vision of the kingdom to achieve all our dreams. And nursing leadership and the ability and capability of nursing leaders is my dream. And I think all of you could contribute in that. Thank you.
Thank you very much, Dr. Hiba. Amazing presentation. Our next speaker is Ms. Mawahib. Ms. Mawahib is the Chief Nursing Officer of Armed Forces Hospital for Ministry of Defense. She obtained her master's degree in healthcare management from Walden University. She has extensive experience in both clinical and managerial area. Her areas of expertise including critical care nursing and leadership. She started the first comprehensive simulation training center and security force hospital. She also obtained accreditation postgraduate diploma in both midwifery and critical care in the military hospital. Her role expanded to be a CNO in the first cluster hospital in the Ministry of Health and led the transformation program for 2030. Welcome on stage, Dr. Mawahib.
It's a big pressure to follow all these good speakers. Thank you very much for inviting me here, Ms. Hera and Musa's group. I was extremely impressed when I visited your hospital 2 months ago, I think it was. I think we need to just clone you everywhere in the kingdom. Today, I'm going to talk about value-based nursing. And the reason why I'm going to talk about that is because as a young nurse, I was very fortunate to have mentors and practiced in Magnet Hospital in the United States for 21 years. Then I moved to Saudi Arabia. And I actually can tell you I grew up more in Saudi than I ever did or would have in the United States. I had the opportunities to be part of designing the transformation efforts in the healthcare, and now had the opportunity of leading the military system and establishing a nursing army. So, value-based nursing, as a definition, what is value? Value is to give the best care possible with the best outcome in a conscious, financially conscious way. This morning we talked about values. We talked about magnet, right? So value-based, when we give excellent nursing care or excellent health care, and we see our patients improve, all of us as clinicians need that to continue practicing, because it gives us the satisfaction that we need to fulfill the calling that we went in for healthcare for. There are many stakeholders to value-based. The society as a whole, if we practice this, benefit because we'll spend less on healthcare. And if we spend less on healthcare, there'll be more money left over for roads, for education, for other programs. For the patient, if the patient is paying out of their pocket, or if even their insurance is covered, they will pay less if we provide good care with good value. The provider, like I said, it's higher satisfaction rate. And for the payers, they will love us because we will only keep patients the amount of time that we need to keep them in the hospital and get them out when needed. For the suppliers, we tell the suppliers what are the best supplies do we need to get the best outcome. So I'm going to go back a little bit to healthcare as a whole. So we know until now, since the very famous movement of 1999, that patients are getting harmed every day. 1 in 10 on the average get a medical error, right? In developed country, about 5% of the deaths are due to preventable healthcare mistakes. In lower middle income countries, it's way worse. 1 in 4 get harmed. And 1 in 24 dies. Those are very alarming numbers. And they have an impact on the whole society. They have an impact on the economy. So, how much do we really spend? As I grew older, I became more and more friends with the CFOs that I work with, because we learned to speak the same language, to get resources and make them understand. I remember in one of the hospitals that I worked with, we wanted a certain project, and the CFO said, no, we don't have that money for that budget. Then I told him, come with me, let's do rounds. We went in the hospital, we did the rounds. By the time we went back to his office, I got the money. So you get to involve the decision makers. So in Saudi Arabia, we spend a lot of money, not as much as some of the countries, but we spent 7.82% of our GDP last year. It is not as high as some of the countries like United States, but it still went up by 59% over the last decade. What is this telling us? Healthcare costs is going up in the country. And every single nurse, even if you're a bedside nurse, you have to be aware of the cost. So there's always a talk in the board meetings. When we're looking over at the budgets, we look at, okay, so where can we cut? And guess what? Nursing. They always look at nursing. Where can we cut? Let's look at the largest number in the hospital. Can we cut their staffing? Nurses, they don't bring the patients in, so we consider them as an expense, not as making money for the hospital. Also, the representation of nursing is very low in the boards. Dr. Hiba a little while ago was talking about the need to increase the representation at the board level. I couldn't agree more. We need that voice at that level. And also, it is our fault as nurse leaders that we did not highlight the value of nursing in dollars or in reals. That's what we need to do. We need to show what do we bring to the table. If we have the proper nursing staff, not only in numbers and not only in capabilities, but also in the autonomy that we give the nurses. So it is our role as nurse leaders to do that. And when I was a young nurse in the ICU, I was very focused on clinical outcome and patient safety. And as I grew older and a little bit wiser, I said, I must add money to my talks. So nurses are always the target when it first comes to reducing the numbers. I hear all the time, why can't we just take all the nurses out of the clinics and have nurses' aid run the entire clinics? It's a thought, but it's not entirely correct. We do need nurses even in the primary care. So this is the average cost, the average turnover. In Saudi Arabia, the turnover, Dr. Muhammad this morning was saying about 17%. Yeah, that is about this study that showed that the cost of 16.5% yield in estimated loss of 4 to 6 million. We also know that if you increase one full-time nurse to every 1,000 inpatient, mortality decreased by 4.3. Each time that we're short on nurses, mortality increases in the ICU 2 to 7%. 46% of the nurses, they admitted to making medication mistakes. We all had medication mistakes. I think that number is very conservative. So we need to talk in this language. We need to define where possible and quantify the economic value of nursing and midwives. The return on the investment is what we need to make very clear, not only to the nursing societies, but also outside the healthcare. I think we need to involve decision makers outside the healthcare to make the work of nursing and the healthcare better. We know that when we have poor staffing, we have increased mortality rate, increased morbidity rate of all kinds, and increased length of stay. Also, in 2014, the midwifery, the World Midwifery, they looked at 83% of all maternal deaths can be prevented if we had good midwifery care. And that most women really do not need physicians when they're pregnant because they're healthy individuals. And midwives can take care of them. So if we know these facts, and we know that if we get midwives and probably trained nurses will have decrease in preterms and decrease in unnecessary C-section, the amount of saving for the society, for the hospital, is huge. Each day a preterm baby spends in the NICU costs at least about 10,000 reals here. It can go up to 30,000 in the NICU. So investing in midwife education can actually do a return of investment 16-folds. What does that mean? That means if I educate more midwives, I will save all the money that we shared before. So if I tell you, if you put your money in some bank that will give you 16-folds, are you going to put your money there? Of course you will. But here we have the research, we have the evidence, and we need to let the decision makers in the government know this so they can increase the number of schools of nursing. Instead of only having 3,800 nurses graduate, we do need about 11,000 nurses each year. So, while we make up the largest number of workforce, the investment in our education is only 25%. How many times do you see a physician come back, Saudi physician come back from consultancy in Canada, where they spend good amount of years in the United States or in Canada to learn? How many nurses do we have that we send for scholarship? Definitely nothing equal to that. In Bahrain, which I really was very impressed, in Bahrain at certain point, in the Ministry of Health, they used to have Dr. Fatma Abdul Wahib, who's just retired now, and she was the head of the Human Resource and Finance at the same time. So whenever she gets a physician application for scholarship, she used to say, go find your counterpart of a nurse and we'll send you. So the physician would go and tell the nurses, hey, do you want to specialize in cardiac ICU? So something needs to be done to invest more in nursing and midwifery educations. And I don't know if we have any midwives here. Yes, I love you. They are orphans. Midwives are orphans. We need to adopt them because they don't have that voice. So nurses and midwives are the heart of the healthcare. So I thought I'd share a local case with you. I just did a presentation to Minister of Defense not long ago. And we estimated during the COVID year, 2 years, we had lost 2.2 billion across the 25 hospitals from nursing shortage. We calculated everything. We calculated turnover, we calculated CLAPSIs, we calculated CAUTIs, we calculated injuries, we calculated increased length of stay, and it was 2.2 billion. Had we had all the nurses, every single position filled at that time, we would have spent 1.5 billion. So 700 million lost because we didn't have the nurses. So this is a very dear hospital to my heart that I worked in, and it's a small hospital, but we decreased, as you could see, the cases of CLAPSI by going through the magnet journey, and we were able to sustain it to 0. That resulted in 2.4 million estimated saving. And this is the reduction in CAUTI was about 623,000. For those CNOs who are going through magnet, it would be nice if you're in your town hall meeting, the hospital-wide town hall meeting, quarterly, if you can present the savings in dollars or reals. Then you get everybody's attention. So that was the total amount of savings that we had in that particular year. I'm just sharing this picture with you because in 2019, Saudi Arabia hosted the ministerial summit. In that ministerial summit, something was born, which we will discuss later on in the leadership meeting. The idea of safe staffing was born. And to me, that is a historic day that continue to affect the way healthcare is conducted in our country, because from that day started a white paper that we wrote with some of our colleagues. Dr. Ilham is sitting right there. She was one of the co-authors of that paper. Then recommendation went up to the safety center. They adopted it. Then it went into our legislative body, Sabahi, and it's going to come out in the next chapter, the next book to 2023. There will be mandated safe staffing in Saudi Arabia. So I always refer back to the ANA. It's like everybody has a little Bible. That's my little Bible, ANA. Only by determining the economic value of nursing to patient, healthcare organization, and cooperation will the profession be able to capitalize on the contribution to its healthcare quality and overall healthcare and well-being of the society. So Dr. Hiba, again, I'm going to refer to her, had called for attention and mentoring of the leadership. I second that, but I also add, let's concentrate. Instead of only talking about patient safety, let's talk about value-based nursing service. Thank you.
Thank you very much, Ms. Mawahib. I was amazed that you delivered a talk, economic talk, value-based, with efficiency, touch, although you're coming from semi-governmental hospital. It's not usually these talks are given by private hospitals. So thank you very much. It was very nicely delivered. Our next speaker is Hera. Hera Tashijian is our CNO at Almoosa Specialist Hospital. She's a bachelor's and master's holder in nursing from Duke's University in North Carolina. She's currently pursuing her PhD studies at King's College London, studying the long-term outcome of ICU survivors. She's board-certified nurse executive. She's also board-certified provider for patient-reported outcome measures, the PROMs, in the value-based healthcare community. She has led and served in many regional and international conferences. And I couldn't agree more with the last sentence, which I will mention now. She's an advocate and mentor for mindful, authentic, and compassionate leadership.
Thank you.
Go ahead.
Thank you, Dr. Zainab. Thank you. Thank you. I'm here on the stage again, so I'm going to try to make it quick in and out. Just give my piece of my mind. And as if, Mawahib, I thought, oh, maybe it looks like we had coffee, and we said, oh, let's talk about this, on the same topic. So a lot of my presentation were included in yours, but I'm going to make your wish come true, and I'm going to show that we did quantify value, and we did put a number on the outcomes that we generated. So we're on the same line, and I'm very happy that we're all talking along the same line of improving outcomes and reducing cost, which brings us to the definition of value. And there are a lot of nurses here and a lot of students who need to know, when we talk about value-based healthcare, we all responsible for this formula. It says outcomes, improve your outcomes and reduce the cost. And each and every one of us has a role in this. This is not only the role of the leadership, and we're all leaders. You're leading patient care, so we're all responsible for improving our patient outcomes and reducing the expenses on that. And transformation starts at home. So we started this transformation, although I consider myself one of the junior nurse executives here. I've only been 2 years, but we wanted to do this transformation at home. And some formulas, they also include quality and service, because service is also included in your value, and that translates in how we coordinate care among all disciplines. So for coordination of care, yes, be friends with the CFO and be friends with the COO as well, because he is the one who is driving all the operations, and have a model where you can start from prevention and detection to population health to preoperative care, surgical and post-surgical care, rehab and follow-up. And throughout these stages, make sure that nurses are included in coordination of care along with all the stakeholders. And care coordination, how important it is, because reimbursement for value-based care is driven by data. And we are rewarded for carrying out coordinated services that are comprehensive and are beneficial to our patients. And from our experience, doing fee-for-service, you know, our nurses are here. Charging every service that we did is very time-consuming. It can be very frustrating for our nurses, but that's where we're going. That's where we're heading. So it's very important that we are very knowledgeable and very expressive in how we can minimize waste. We are black belts and green belts and yellow belts in our hospital. And we get down and dirty to streamline clinical workflows from pre-appointment to intake to discharge and follow-up. And when we talk about outcomes, we're talking about our patient-reported outcome measures. We're talking about patient-reported experience measures. And this is, you know, where technology comes in as well. So when you integrate technology, that's always going to add on your outcomes, and it's always going to infuse in your patient experience. So this is one of, I think this is Cindy. She's accessing the automated medication dispensing cabinet, and Hanelet is, she's accessing our hand hygiene, which is connected to the RTLS, the real-time tracking system of the nurse. So you can track how well the hand hygiene is doing and translate that into outcomes. Years and years back, Dr. Mona is here, we have adopted some of the ICHOM standard sets of outcomes, and we have integrated them in our electronic medical record. And for patient-reported outcomes, we have measured how well are we doing. So this is one of the examples of many patient populations that we have taken. This is the orthopedic TKR total knee replacement patients, and we have tracked down how well we have done over the years from 2015 to 2021 on their knee flexion, and how have they done for their mobility, for their pain management, self-care, ADLs, and anxiety. And as you can see, the numbers have increased drastically after the TKR. We have shown a reduction of 20% in complications, 17% in costs, and we have completed that with our 2022 cohort of total knee replacement patients. We did 181 patients for a total of almost 3,800 sessions, and look at those outcomes. We measured how much time they are spending until they get a consultation for a physiotherapist. And 96.5% of the time, we met that outcome within the 3 days. Pain management, improved score in 90% of the patients, improved, it exceeded our outcomes. Self-care, ADL, and PREMS as well. So we have measured this in other populations as well. And when it comes to nursing outcomes, yes, do become friends with your CFO, as if we've spoken about this. He's my friend. So there you go. That's Mr. Shalish, and we have become friends just because I wanted him to help me find the value of the CLEPSI rates that we decreased. So here we are. I'm making your wish come true. We have implemented a bundle with a CLEPSI nurse. I assigned a CLEPSI nurse to work on our bundle. I needed to show, hey, how come you employ a whole FTE to work on your infections? And I showed the numbers. We decreased 6.2-fold, and guess what? We did our own calculation. AHRQ, yes, estimates that each CLEPSI cost us $48,000 in US. Well, in our hospital, we got down and dirty and calculated every single step that it took for us to save one patient. And each patient costs us 86,865 riyals. So when I could show those numbers, I could justify why I put a nurse to work on our CLEPSI. Sounds good? We did the same thing for COTI. And again, COTI, the mortality is not as high as CLEPSI, but there it is, 64,658. It came down to the reals. So, and the nurses who are here, they worked with me on this one. So it's, we had a workshop in my office. It was on the weekend. I was like, you need to come in. We need to calculate every single thing that we did so that we can put a price on it. And we celebrate. And not only the CFO, you become friends with the Chief Experience Officer, who is newly promoted to our CEO for Rehab and LTC Center. You become friends. It happens that we are naturally born friends, Mona, but it helped that we were friends to improve our patient-reported experience measures. Again, for our ortho patients, look at those colors. You don't have to look at the numbers. But again, from quarter 1 to quarter 4, we were red, we became green. And the way we did this is hand to hand, looking at our access to care, coordination of care, care provided by nurses, care provided by doctors, our patients' privacy, and our patients' response to complaint. Don't forget to celebrate. We are big on celebration. Every single thing we do, we gather together, we get a cake, Dr. Zainab is there. So just celebrate. This is the zero restraints for 18 months in our long-term facility. Happy, again, zero happy. I hope that we will transfer this message to our students in our college for allied health, and I hope that we will transfer this knowledge to our rehab and LTC center, and hopefully in a few years in our Khobar hospital, which is going to be our flagship hospital, and I thank you so much.
Thank you very much, Hera. My next speaker would be Ms. Nada Masoudi, and I just recognize she is the first recipient of Daisy Nurse Leader Award in Saudi Arabia. This is amazing. Ms. Nada is a BSN registered nurse holding a master's in medicine, infection and immunity from Sydney University with postgraduate diploma in nursing leadership and management. She is CNO at International Medical Center in Jeddah. Ms. Masoudi she joined IMC in December 2018 and has more than 20 years of clinical experience in nursing and healthcare system. As I mentioned, she is the first recipient of the Daisy Nurse Leader Award in Saudi Arabia. Welcome.
Okay, so good afternoon, everyone, and what's great pleasure for me to be here today. It's an amazing day, being connected with all people. I would like to appreciate Ms. Hera and all Almoosa Hospital's team for bringing and magnetize all the hospitals together, which is the effect of the Magnet program also. So thank you very much. Now, when Ms. Hera, she called me and she told me I would like you to present among what is the role of nurse leaders with the vision of 2030. I know that all of us, we almost speak the same. And that's why I haven't put in my presentation about what is the vision gonna be, because I'm sure Dr. Muhammad and also Dr. Hiba, they present a lot about where the health sector is going to go and expand in the kingdom. However, I share today an experience started with me as the first Saudi nurse being a CNO for a private hospital in the kingdom. It's a big challenge for any private hospital to attract and to retain Saudi nurses. So here I am, and I've been now with the IMC International Medical Center for 4 years. But what kind of challenges we face during all those years? To start with, I'm going to give a little bit overview about International Medical Center. Then we're going to speak about the Saudi nursing journey at IMC. And I always love to talk about success stories. IMC, it's very unique with their mission, where we look to how to approach the patient in a holistic way, looking over his body, mind, and soul, by applying all the international and national standard. And that's why we are utilizing magnet standard as a tool to improve our practice and to elevate our standard. And also by using divine ethics. This is the logo of IMC. It's 5 crescent, where body, mind, and soul, and also the global standard with the divine ethics it's including. So, IMC, it's around 200 beds. However, it's expanding now. It's a multi kind of a specialist. Medical, surgical, of course. It's a tertiary hospital where we perform also open heart surgery, have an ambulatory area also. We have around 2,000 and more outpatient visiting our hospital, around 30 surgical per day, and more than 100 patients visiting emergency department. So we need to be sure that nursing services at IMC, it's met the requirement and the mission of IMC Hospital. And that's why, as I mentioned, we are using magnets since 4 years ago as a tool to uplift and meet the hospital mission. So providing the nursing services mission was an amazing work from all our colleagues in nursing. Frontline, they came all together. They had a good workshop, and they look over the hospital mission and vision. Besides that, we put the vision of the Kingdom 2030 in front of us. They also come up with the strategic of nursing. And I was very glad because every year we revisit our strategy, and they include the well-being program in our strategy to be aligned with the hospital strategy. So, all those strategy, we built a different dashboard. And as Ms. Hiba Mawahib, she highlighted about the value base, and also Ms. Hera, she spoke about how she present the cost and the revenue for the organization. We do the same. We have one dashboard, it's called a budget dashboard, which also includes the cost reduction in our hospital. And we present it to our leadership. And just, I think 3 months ago, we present the value base of nursing at IMC. So each of those strategies have a clear dashboard to be sure, do we perform well? And this dashboard, it's in a daily basis monitored. What's happened? As usual, the most common challenges we face is the shortage of nurses. And after we investigate our shortage of nurses, we find out that the majority of nurses, their turnover is really high, are Saudi nurses. And we've been wondering why. What's going on? Why Saudi nurses, they don't even stay in our organization more than a year? There, where it takes up us to a level to monitor the Saudi nurses in the hospital since the hospital started, which is 2007. And we find out that every time we hire Saudi nurses, as I mentioned, they don't stay more than 1 year. That's put ourselves in unstable situation, no sustain of a practice. You train and then they leave. So, me and the HR director, we met together, and we decide by the hospital leader direction, we need to work and retain those Saudi nurses, and we need to work on how to improve the situation there. So we put a lot of activities, and one of the important things what we had put is what exactly we want to be. We want to be a hospital choice to attract all talent Saudi nurses and to retain them. From there, we change our organization structure by including Saudization manager under nursing education department to be more focused in Saudi nurses. Why Saudi nurses only? Because we all know here in the kingdom, we only hire new graduate Saudi. The rest, they come to us and join us with experience. So transition to a practice is the most difficult time for any new graduate person to decide where they're gonna work. Not only that, working in a private hospital, they have a belief that this is not a secure job. Same as me. I used to work more than 21 years at Security Forces Hospital, belong to Ministry of Interior in Riyadh. And when I receive a call from the CEO and the CMO of IMC hiring me, I told them, come on, do I'm gonna leave a government hospital and come to a private sector? No way. After that, they told me, come and check, and you're gonna be impressed, and we're gonna give you all the full support. And here I am up today. I'm gonna move to the 5th year at IMC, and I'm very proud. So what else we had done by creating this position? We also create a committee focusing in Saudization committee, where also the nursing residency program reported to this committee. In those committee, numbers of a frontline new graduate, and we let now the student, the intern, sitting in those committees, because we want them to be engaged from the beginning and to listen to them. So, following that, we conduct a survey, listening to them, why they leave a private sectors. Now, some of the private sectors in the kingdom, they have a good numbers of Saudi nurses because they have a college, like for example in Almoosa, they have a nursing college, and also in Riyadh, in Jeddah, Faqih and German hospital where they have. However, in IMC, we don't have a nursing school where we can hire those Saudi nurses. So when we create a survey, we find out that the most common is about salaries, where we work hard to bring their salary up to the government level. There are also other things, and that's what we work on, like, for example, professional development. From there, we create a very detailed dashboard for Saudi nurses, including also the university and college who provide us with those nurses. And we also build a good collaboration with the intern and postgraduate degree, where we develop numbers of Saudi nurses because they want the opportunity to be scholar for their master degree or any other advanced level. We also build a career pathway from the day they join us. We want to know where they want to be and how we can help them and provide them. And I would like to thank the PTAB program, how they help us to develop the succession planning and the mentorship program. We develop a pioneer Saudi nursing club where I sit in and we just chat. We have coffee. Sometimes we go outside for dinner or walk in the garden. We conduct a walking with the CNO where I walk with anybody who wants to join me. And majority of the time is the new graduate nurses who want to know more about this profession. We also have, as I mentioned, a good, strong relationship with numbers of colleges, such as King Abdulaziz University in Jeddah. By implementing the nursing residency program and being in the PTAB journey, I think we achieve a lot. And I heard from our site visit, the virtual site visit, how our nurse residents are vocal and empowered to speak up, because they are sitting in every committee and they are part even in our nursing leadership committee. They put decision with us and they change numbers of practice in our organization. I'm very proud from ANCC to provide us with this kind of a standard, guiding us, helping us. So it's not a matter of having a certification in the wall, it's more on lifting up a true change in the organization. We also modify our preceptor program to be sure that the new graduate get what they want, and also to be sure that the preceptors, they know how to care for those new graduate people. As I mentioned, the career development program, it's not only for Saudi nurses, but for Saudi nurses is mandatory from the day one they join IMC. We also developed the mentorship program, and as Dr. Hiba, she mentioned, we need to have it across the national level, not only in local and specific organization. Well-being program, it was one of the success stories. And let me tell you a secret. I lose 6 kilos in almost 8 months because of the well-being programs that nurses put it and they push me to be engaged with. Not only that, one of our also success in IMC being a care network with Mayo Clinic, having a good relation and a support to send our staff who've been enrolled in a leadership program to be trained there and to gain from their skills and their knowledge. Also, we had the privilege that Mayo Clinic came to IMC and established for us nursing education program. Finally, there are many success stories at IMC, but as you can see the green line, how we increase the numbers of Saudi nurses in IMC from 25 to 127 nurses being hired, and the retention also, it's reduced. Not only that, you're gonna tell me the red line, it's about hiring. So why from last year we are not hiring more Saudi nurses and the hiring rate, it's go down? It's because there is no vacant position anymore. So, if there is other success story, yes. We used to monitor also patient satisfaction, and we've been worried, how is the effect of all those numbers of new graduate nurses joining us in a different level? We don't take them only in inpatient area, we hire them also in a critical care area. As you can see, in everywhere, we are above the red mark, which is the GCC, and the green dots is the American standard. So we achieve, and also we build our dashboard where we want to be above and above. Also, 1 month ago, IMC received the best patient experience at Saudi Arabia. So I really appreciate all the support. Our Saudi nurses, they don't stop in IMC only. They share in the community. And I'm very proud of them when they come to me and tell me, Miss Nada, or sorry, they call me Mom Nada because I don't accept anybody to call me rather than Mom. Can I join the Hajj as a volunteer? Can I be in the COVID campaign? Can I be in giving a speech about breastfeeding, about knee replacement, sleep, whatever cases they look, and they participate as a volunteer without any benefits. So thank you very much for all Saudi nurses and also for the other nurses, because without you, we cannot be where we are here today. We appreciate the support from everybody, and a special thanks to Ms. Hera for giving me this opportunity. And you start the magnetize of Saudi hospitals here in the kingdom. So congratulations and the best wish for everyone. Thank you.
Thank you, Ms. Nada. Inspiring success story. Now with our next speaker, Mr. Abdullah Ali. I cannot pronounce your last name because I'm afraid that it will be, it's in Nagala or what? Okay, good. He's an experienced critical care nurse leader with more than 30 years of experience. He has a BSN in critical care nursing and a master's degree in healthcare management. He has vast leadership and improvement of project experience. His experience also in evidence-based, cost-effective, quality patient care. He is currently working as CNO for the Eastern Health Cluster of Saudi Arabia. Welcome, Mr. Abdullah.
Assalamu alaikum. I think my presentation is very challenging because everything has been spoken about already, so bear with me. Thank you very much for inviting me to your conference, Ms. Hera. Thank you to Almoosa Hospital. It's an opportunity to meet these great leaders, seniors, a lot of my bosses here, and those that made me what I am today. So I'm really grateful to be here. So I'll just round up by talking about the role of nurse leaders in Vision 2030, because everything else has been said. So that's why I just choose this. It's not working. Yes. So I'll just start by saying all that we're talking about is about a mandate for quality, safety, and sustainable outcomes within a cost-contained structure, and this always remains the hallmark of healthcare success. Therefore, leaders, for us to achieve this, have to be transformative innovators for this kind of outcomes to be meaningful, value-based, and sustainable. And if we do that, you find out that we have sustainable outcomes will be evident in direct and indirect savings, which has been showed by Moahib and Ms. Hera. So because of that, for us to be effective strategies must be implemented to accommodate the new outlook for the 2020 vision. And once this is done, it is in order to advance the nursing profession and to improve healthcare delivery. So for that, we really need nurse leaders and policymakers to improve nursing in this great kingdom by addressing the nursing shortage. When we say shortage, we are not talking of numbers only. Dr. Mohammed said something: capacity, capability, I will add something, ability and composition. We have to generate strategies to improve nursing education, which we've all spoken about greatly here. And really, we have to establish a robust scope of nursing practice, something that would guide us, approved, and nobody can deny that anywhere. This is all about achieving sustainable outcomes. How do we do that? It requires for nurse leaders who are visionary, transformative. All that is being said here is about visionary and accountability. We have to engage all stakeholders. Hera and Moahib are talking of being friends with CFOs. I think you should go even beyond that. We have to be influencers, and we have to remain mindful of all benchmarks, international and national. That's why Stockdale went on to, it's about influence. Process of influencing the activities of an organized group in the effort towards goal setting and goal achievement. So leadership is about influence, nothing else. The more influential a leader is, the better. So it is about an influence not by force, by will. This is all about magnet. You get all the nurses to do the right things because you put them in the right position and you've influenced them in the right way. So this is all about Vision 2030 is the scale of nursing contribution toward the success of healthcare in this great kingdom. How do we do that? We have to have adequate human capacity knowledge. We have to have supportive financial, organizational, governance, and regulatory structures. These are all knowledge every nurse leader has to know. If we don't know it before, now we have to know it. So from charge nurse up to the most highest nurse in the facility. So achieving sustainable outcomes by simultaneously working with the IHIMs, now it's about 4, not 1, that is improving the patient experience, improving healthcare populations, and reducing per capita income. Additionally now is improving staff satisfaction. And that goes with the global strategic for nursing and midwifery, which is leadership, jobs, education, and patient delivery, care delivery. And that can only happen when there is transparency, accountability, effective participation, and functional empowerment. Empowerment has to be there. The whole aim is for us to reach a high-performing healthcare organization. For us to do that, we have to synthesize and apply quality and safety improvement method. We have to promote sustained improvement of an identified goal through effective application of quality improvement tools. We have to integrate improvement science, complexity science, quality and safety tools and methodologies. You can have all that, but is it enough? No. You have to have the ideal work environment. Every staff has its own personal values, it's from a family, and we have organizational values. These two have to overlap. There have to be synergy between the two. So we have to make sure the work-life balance of our staff is looked after, they are cared for, and in this juncture, I will say, they are paid at the right rates. You don't expect me to be in the ward doing night shift and weekend while I'm earning the same salary with someone in the OPD. It doesn't work like that. We have to have system to be able to say thank you, even no matter how little it is. Sustainability model, this is the one from the NHS that looks into the process, the staff, and the organization. Process that monitors progress, adaptability, and credibility of benefits. Process that goes beyond helping patient only. It helps the staff also. Staff that is well-trained and involved with the right behaviors, with senior leaders that have gone through robust succession planning. I agree with Dr. Heber that talks about leadership. Leadership is very important. Robust succession planning, while frontline staff, they have to have an excellent mentorship, which was also mentioned by Ms. Moahib. These two has to go hand in hand to have development. Despite the fact that no matter what it is that the organization gives you of the structure, you have to have things that are fit for the goals to carry out whatever is meant to be carried out in that structure. That's why Gallup identified 4 distinct domains that we as nurse leaders have to work for. We have to be executionists, executing. That's why some of us are called executives. And a nurse is an executive at any level. We have to be influencing. We need to talk to people to do the things without even them knowing they are doing it, with the passion of doing it. We have to be relationship builders, because most of the nurses that are late or absent, they have their own problems at home. We have to go through that to help them to be better at their work. More importantly, we have to be very, very strategic thinkers. So to activate functional and transformational sustainable leadership abilities, there have to be functional empowerment, like I mentioned earlier on. There have to be accountability on both sides, the employer, the employee, and the leaders. There have to be effective participation of everyone else. There must be transparency. I should treat everyone equal. I should give them equal rights, and I should give them the opportunity to practice as well. So we have to be, I mentioned earlier on, we have to be leaders of influence. Leadership is influence, not more, not less. So it's about influencing and empowering the multidisciplinary team to function at their best on daily basis, and that's what we are doing in Magnet. It's about creating the right environment that conducive to the patient outcomes, to the best patient outcomes, as well for growth and productivity of our staff that are carrying out those duties. We have to listen. We have to listen. There is no other way. We have to strive to establish a rich culture of communication with our team. We have to create the right avenue that the team can bring new ideas. That's where Magnet comes again. Because successful leaders have an exceptional ability to simply listen. If you don't listen, you will eventually be surrounded by people who have nothing good to tell you. They will tell you what you want to hear. But is it the best? No. Most of the time you end up failing. And those people will be the ones that leaving you. When you are not there, they will not even call you. They won't send even text message. They are just there because you are in that chair. When you leave it, that's it. Khalas says in Arabic. So we have to have winning strategies. We have to have winning strategies in nursing. What is our winning aspiration? To attain and maintain nursing excellence. This is our strategy and has to be made and repeated several times. Where can we play that? We have to have priorities that will eventually lead to high volume, high impact, and high adoption throughout the system. How can we do that? Effective strategy and plan. And what capabilities must be in place? We have to have capacity building and strategy enablers in our place. And what management systems are required? We need KPIs, which was mentioned several times here, and we need dashboard to show what we're doing. I would say in this juncture, we are not very good at selling ourselves. And I've seen it with the COVID. We've done lots of the things. Our nurses, some of them lost their lives, but we're very shy. I think camera shy. We don't show it. For us to have the sympathy, the empathy, and the support of the public, we need to learn to do this. And for us to improve the image of nursing, that has to be done. I once said to somebody, among us, most of us, if we are given the chance to give our children to go to nursing, will say no. It's not because we don't want the profession. No, because we don't want them to go through the struggles that we are going through or went through. So let's make it a lovely profession. But you go to the doctors. Sorry, Dr. Zainab. You find a lot of doctors, their children and grandchildren are doctors. But how many of us here have got our children as nurses? You can count in your fingers. So there is a reason behind it. We have to have strategic priorities for sustainable nursing quality and patient safety. How do we do that? We have to have the capacity and capabilities, the structure and the framework, the roadmap to nursing excellence. All this will only be available and operational when you have team engagement. Everyone has to be there and has to be done. And these explore issues, opportunities, leadership, engagement, and staff empowerment. So how do we make sure we are sustaining the improvement? We have to have standardization of things. A process has to exist to help define and disseminate standard work, what to do, how to do it, because what do you expect your staff to do if you don't give them the right guide? And not only our staff, the multidisciplinary team has to know what we're doing. Like Moahi is saying, give them in dollar the money amount that is required. And the effect that we get from getting it done that way and the cost cut. We went and did a presentation that was not long ago, and my CEO was not happy with our presentation. I told the staff, when you go, that's how you do it. But people went and were reading everything. He said, I want to see the dollar value of your presentation. So that affirms what Moahib said here. So we have to be able to do that. And once we do that, we have to be accountable for everything that we do. It's not only him. When is successful is me. When is a failure is them. Everyone has to be accountable. Therefore, we have to provide the standard and seek feedback from our staff and our colleagues. This is all contained in Magnet. We have to have periodic review of our compliance. Do we need pressure? Has the environment changed and the new way needs adjustment? So with this new transformation, we have to be asking ourselves as we go. We have to set and communicate expectation, that the result of the expectation is we are needing excellence and nothing more, nothing less. I spoke about the visual management. Visual management goes a lot to spring out our behavior and to change our approach to things. Process performance information should be continuously available to synchronize staff attention and guide current activities. Those hospitals that are going through Magnet journey now, they know that better than anyone. Because part of the things Magnet will check is, what have you got as visual presentation of what you're doing? And alhamdulillah, we've done that. So we have to continue to focus on the why. You beat the drums, nobody will beat it for you. We have to beat the drums ourselves. What are the vital few metrics we need to continue to share? How often? Who is responsible? Staff need data to guide their work, not only staff, everyone else. How will you provide the data? Is it through email? Is it through huddles? Now the huddles are everywhere. Is it through bulletins? All this had to be together. Because the saying is, out of sight is out of mind. If you don't show it, nobody will see it for you. You have to show it. So we have to continue telling our staff, what you do, come out and celebrate it. Don't leave it with you. Nobody will know it. What should be our strategies for continuity? We should continue to use the tools that are known to be effective. That's why we say evidence-based. We should communicate between the care team. We should have visual postings of unit data and algorithms. We have to have strategy for education of new staff. We have to continue to perform audits on what we do. It's not always good news. We have to accept not good news also, so that we can improve on it. And then we have to continue to track and publish, provide a specific target. What we set for ourselves, we really need to continue to track it. And we have to keep on the quality boards like I mentioned earlier on. I will make a story a similitude, and I will see whether we are in affirmation of what Ms. Hera says during her presentation in the beginning. Imagine the new journey you're going through is a brand new car. A car has many accessories, isn't it? We have a lovely driver, excellent seats for our passengers. Everything is good. You have benzene, you have the engine, excellent. I'll ask one question. I know we're all tired now. Maybe that will wake us up. Among all the accessories, the passengers, the driver, and everything, who is the most important to ensure that we are delivered to the right destination? Huh? Who? Driver is there already. You can change the driver and put any driver there. Huh? The brake is an accessory, yes. The steering wheels, the driver uses it. Who else? Huh? Huh? Who says engine? Who says driver? Ms. Hira says nursing is the engine of healthcare delivery. Driver is very important, yes, but you can change the driver overnight. Passengers can come and go. These are our patients. The wheels are the multidisciplinary team. But all these things cannot happen without a good engine. You can have all these things without the engine, you're not going to move anywhere. So I believe with Ms. Hera, nursing, I will be biased here as well, is the engine of healthcare delivery, whether we like it or not. So this engine, it's not easy to change an engine, isn't it? But any other thing can be changed. So these are nurses. This is the similitude of nursing in healthcare. Therefore, we have to engage, involve, empower, and appreciate this engine so that we can have a safe, timely, equitable, exceptional, and patient-centered care. Thank you very much.
Thank you. Very nice speech. And now, Dr. Mohammed Al-Ghamdi, it's your turn. Yeah, I would be grateful if you call all the panelists to come back on stage. Ms. Mawahib, Dr. Ilham. Okay. Dr. Anada. So by the end of this session, we will be receiving questions from you. If you have any question, we're ready to answer them. Yeah, sure. Dr. Amina.
Thank you, Dr. Zainab. What an amazing conference. Sitting here just listening to all the speakers, the first part and the second part, I never felt boring, like maybe I do in some of the conferences, but not this one. Actually, really, these speeches, they are really sounds to each other, and they are on the same line. The speaker, I forgot her name, that she spoke about she's in the defense. Mawahib. She was asking questions and Hira answering these questions. It's really amazing. Now, really one thing I want to emphasize here, that everybody talking about the quality and everybody talking about the cost. You want to reduce the cost because Mawahib, she asked how we cut the cost. You don't cut it. You just raise the quality, the cost will go down. This is really something that we have to believe in. And when we talk about equality, we talk about the satisfaction of our stakeholders and our patients as a customers, their relatives, the visitors, everyone that we are dealing and providing service to. And I believe when we talk about excellence, we are exceeding the expectations of our stakeholders and customers. And this is what we want really to do. We have to emphasize that patients, when they walk in the hospital, they have some expectations in their head, and they are in need of your care. So once they will get the service they need or the care they need, that means you meet their expectations. But when you are exceeding their expectations, that means you are really providing excellence of care. I congratulate you on really an amazing management of this conference. Thank you.
Thank you for your notes, Dr. Amina. Anyone wants you to comment on that? Okay, we'll have the second question.
Good afternoon, everybody. I would also like to echo that I too have stayed awake, very attentive, and the speakers have been exceptional. My name's Cheryl O'Connell. I am here by default from King Faisal, and I am so appreciative, really, that I was able to come. I guess my question for us leaders, nurse leaders, is how do we become a program or a profession of attraction, right? We need to attract, retain the best and the brightest that nursing has to offer. And some of that, I think, we have to dig down a little bit and start recognizing that there is a moral distress at the bedside. There is a cognitive workload of the bedside nurse. So you can tell by my hair that I've been doing this a long time. And when I was a young nurse, I look at all the sea of young, bright faces. They weren't following me around. They weren't asking me about my patients and my patient experience. You know, things have changed so much in the last 40 years, and I look at these young, bright things at the bedside trying to manage the electronic medical record, the demands of the patients, and the demands of the physicians. It is a challenge, so I feel like we need to really start looking at that sharp end of care and how we, as leaders, support that so that we can retain those critical bedside nurses that we need to provide the safety net for our patients, because really they are the last safety net for our patients. So I'm curious as to as we move forward, how are we going to become a profession of attraction? You know, in the United States, I'm sure it's similar here, but you know, your parents are proud, oh yeah, my son's a doctor, my daughter's a lawyer. I want that same connotation to come across when somebody says, my daughter or son is a nurse. Because for me, I feel so privileged and grateful that I was able to come into this profession. So thank you all.
Thank you for the question. I think you really highlighted an important part of role of the leaders to empower and support bedside nurses. And believe me, if there was distress at the bedside, there's much distress at the leadership level. It was a joy to take care of a patient. However, it has different type of distress. I think the speakers today at different levels shared some of their strategies, spending time with her team and walk with CNO for Masoudi's presentation, Hera with her acknowledgement of their day-to-day work and how she support her team and acknowledge them and speak about their achievement at different hospital huddles and achievement and linking their name. The lovely when she mentioned that they were with me over the weekend to calculate every reals. And that was a theme that has been discussed in majority of the presentations, how Ilham was showing the pictures of her being with the bedside nurses, mentoring them, teaching them. And I think those are all strategies that is there to first listen to their concerns, help them to be able to overcome them. And that often comes with, although it wasn't a presentation about this, but however, it all linked to leadership round, listening to your team, acknowledging their involvement, as well as work with them and empower them to come with the solutions themselves. So when you come with a problem, they are engaged in providing those solutions, which again came with all those successful projects. So I think that was really lessons that came hidden in all the presentation that I've heard today.
And additionally, we all have a reason why we came into nursing. I was once asked last month by some executives, why did he become a nurse? I remember when I was 12, I was hospitalized. I was looked after by an excellent nurse that time. Then when I was going out of school, then there was a talk about nursing as a career, and that brought back that memory, and I joined nursing. So I think once we have the nurses that are proud of their profession, they will be able to draw other people into the profession. And how do I get to know about Kim Fahad Hospital? Mind you, I forgot to mention them, but I will mention them here. Kim Fahad Hospital nurses, I don't know how to describe them, but they are one of the best nurses I have ever worked with. They went through magnet, and they got the magnet with closed eyes. I was interviewing a lady when I was with Nada in Security Forces Hospital. This lady, were interviewing her for the surgical ward. I asked her, which hospital were you from? She said to me she was from Kim Fahad Specialist Hospital, Dammam. I said, why are you coming here? She said, you know what? I'm only coming here because my husband is transparent here. I have been there for 16 years. If not because of that, I will never leave that hospital. It's one of the best I have ever been. And that's why I started checking for where is Kim Fahad Hospital. You see how staff are drawn? At my level, and then I was an assistant director of nursing, but I start checking and look for Kim Fahad Hospital. So we have to look up to our nurses. Safe staffing has to be there. Pay for the right pay at the right time has to be there for us to be able to retain and maintain nurses and for them to be proud of bringing others into nursing. Thank you.
agree with all of the above, but I think we need to address the elephant in the room. What makes people go into a profession from the beginning? Guess what? In 2000, I think it was 2002 or 2001, in Houston, there was a severe shortage of nursing. The hospital, Methodist Hospital, increased the pay, almost double the pay of nurses. Everybody went to Methodist. The other hospitals then made the same, so the pay went higher. We saw accountants, engineers come to the nursing profession. To answer your question, how do we make young generation say we want to go into nursing? Pay them what they deserve.
You have so much fans now.
Go ahead, John. Yes, fine. Okay. Dr. Moa, I couldn't agree with you more. I think that round of applause said everything. I'm John Sedgwick. I'm Director of Education at King Faisal in Jeddah. In the UK at the moment, nurses are on strike. I saw a report last week that said nurses in the States, I think they were on strike for 2 or 3 days, and they got what they wanted. Nurses are fighting globally for recognition. We know that. Nurses are not very well paid. Many organizations have different levels of pay depending on which country you're from. That should not happen. That is discrimination. That is the elephant in the room. So my question to Dr. Al-Ghamdi, is he still here? Nice to see you. Firstly, thank you to all the speakers. It's been a great first day. I have concerns about the large numbers of nurses who are diploma holders. There are many nurses who feel they've been left behind. The magnet model, as we know, requires nurses to have a baccalaureate degree. In the Kingdom, there are very few institutions that offer bridging programs. What's interesting, your data today showed huge numbers of diploma-level nurses. How are we going to help those nurses progress in their career, maintain their degree? I was talking to one of my colleagues from the US. We talked about the importance of adopting a different model of education. Many countries in the world adopt distance and open learning programs, high-quality programs. Yeah? What I'd like to ask you, I understand now we've got the Saudi Electronic University. Do you see in the future the possibility of our Saudi nurses undertaking a rigorous, high-quality, open distance online program? It keeps them in the workforce. They don't have to leave for 2 years and do a bridging program, and it helps them apply what they're learning. I know at King Faisal in Jeddah, we have career clinics for our nurses. We support them to develop, and this is a big concern. We have about 100 nurses who need to bridge. What are your thoughts? Thanks.
Thank you, John. I really appreciate your questions. Actually, as we presented, we have huge number of diploma nurses as we are going to corporate. Our operational sector of Ministry of Health means to have different way of managing the hospitals. The corporates, which is Saha, a holding company, going to have a very selective criteria of bridging more than 40,000 Saudi nurses. So they look to our new nurses with a very economic investment mindset. Are we going to invest in, like me, 50 years old, male nurse having diploma, or I will go to those who were within 20s? I'm with this criteria. At least we still need 25% to 30% of our workforce diploma holders. That's fine. But still, we have to decrease this number from, actually, currently we have 67% of our Saudi nurses are diploma holders. And this is within our Vision 2030. We need either they to bridge them or they will retire, or the rest will remain within our 20 to 25 to 30%. Currently, the challenge is not here. We will pay for this. We will pay for bridging them, either in Saudi Arabia or any other academic institutions abroad. The issue here is the minimum numbers of seats available for our nurses. The bachelor degree, we have only 14 bachelor degree schools only provided. These are the only number. As we presented, the only average we have, which is the graduate nurses every year, between 3,500 to 4,000. If we stay to this number of poor graduation level, we will achieve our target within 30 years. So the only way to do this, to increase the capacity of our academic institutions. So that's why we support private sector. I was so impressed and happy seeing our nursing students within Almoosa College. Hopefully to have these numbers increasing dramatically with the next future, to have at least the recommended ratio between the diploma holders and the bachelor degree. What I mean now to conclude is something, actually most of the countries already gone through this. I remember Bahrain. They celebrate 5 years ago the last diploma holder bridged to pass a bachelor degree. We need to see this within our next future. Thank you again, Mr. John. I really appreciate your question. It's really challenging. The future is actually promising a lot with our current leadership, and with your support, of course, we will do the best as we can. Thank you, John, again.
Hello, wonderful speakers. There is a panel of amazing leaders in the Kingdom of Saudi Arabia in front of us, and there is an audience full of inspiring leaders that are sitting here. If you had to go back to the beginning of your career, what would you tell yourself now of how to become you in the future? What's that one pearl that you want to tell this entire audience that they need to latch on to potentially be those future leaders 10, 20, 30 years from now?
I'll answer this, Sherry. Thank you so much for this great question. I think I wouldn't follow success as much as leaving an impact, because honestly there's two different things. The way that I see it in Saudi Arabia, mashallah, it's amazing in a very short time how Saudi leaders and even leaders non-Saudi in Saudi, what they have achieved. If we want to look at this, definitely it's success. There's no doubt. In such a short time, each one of them on their account. But if we want to look at impact, and what do we want? If we want to look back, Saudi now need people who can lead from the back, like you said, Dr. John, who can be letting the team go on, who wouldn't be looking at success the way that we drive success now, because it takes so much time from the time that you have to give, to be the servant, because honestly, for me personally, I think That's what I go back. If I learned what I've learned now after Mecca, I would be a servant day one, because in the heart I am. Thank you.
You've asked what we would do and what advice we would give to the new generation. I would think self-discipline and being humble. No matter how we learn, we should always reflect on how we could do it a better the next day. I think if you continue to be humble and discipline yourself, start with changing yourself, and know that learning is a continuous journey. And if you are humble enough to know that I know this, and I'll learn this, and I'll expose myself to this, and be persistent with that journey, I think that would reach you places that you yourself would never think that you could reach. So that I think is two simple things that start with the person, him or herself.
Okay, so I would like to add here, from my experience, you have to feel your patient. Once you feel your patient and you become advocate for your patient, you will grow educational, professional, and you're going to give the best with high quality of your patients. The other important things also besides feeling your patient, appreciate giving, because the profession of nursing is more about giving. Don't wait to be rewarded immediately, because the rewards would come one day for you. Once you appreciate giving, it's meaning a lot. I remember when I started at IMC, I went to one of the patients, he called, and nurses were very busy. So I went inside, and I find that he wants somebody to help him to change his position and give him a little bit cleaning on his back. So I dress up, and I went direct, and I passed the patient at that moment. While I'm doing that, the PCA, she came. She was shocked, finding a CNO inside, giving a patient a bath. So she went running out, and she called the nurses. She told them, go quickly, or we're gonna be banished. When they came, they was surprised. And I told them at that moment, this is the moment I appreciate what I'm doing. This is the moment I feel who I am. They have to appreciate the profession of nursing, the concept of giving and loving. Believe me, it's mean a lot. Whatever position you're gonna be, it's only a piece of puzzle. You complete a picture of the nursing services, whoever you are, a CNO, educator, clinical instructor, a manager. In the end, we are holding a role, completing a full picture of who we are. Last things, nurses have to connect together. I really appreciate where we are today. Connecting all leaders together, speaking the same language, helping, supporting each other. That's important. I always have a good connection with people outside Kingdom. And I was always wondering why we are here in Saudi Arabia. We don't come together. And now it's happened. I know it's the vision of 2030, which lead us to be where we are today. But we have to maintain it. And we have always to think that whatever we do, we are saving our country and we are saving our world. COVID-19 prove nursing profession wherever they are, they serve the world. It's not only one place. So thank you.
Just a couple of things. Of course, I agree. Humbleness and patient care. You can't be a nurse leader if you don't love nursing care, patient care for sure. But also some of the things that have helped me along the way is just stopping some of those narratives in my mind that, nursing is not respected, or when are we going to get the respect we deserve? My husband is a doctor, and my kids don't look at me in any lesser way than my husband or my family members. Not because, it's just, that's how it is. We keep saying things like we should be at the decision-making table. Well, nobody's going to invite you. Just show up. So just show up, Or we keep saying, we should sell ourselves. I was just telling Hiba, on the side, I sell myself. We sell ourselves very well. And it's not because of me, but it's for the profession. We had an exercise, I don't know if you remember, the managers are here, they remember. We had to cut down on some cost. You remember the Oracle approval system, Sinan and Abdallah? We had, all our caregivers had access to the Oracle so that they can approve requests. And then the administration said, no, we need to cut down that so that, so we had to cut down to 2 people who have the access to have requests. Of course, this kind of destabilized the unit because now you're letting only 2 people access it. But we just turned it around completely into, wow, this gives us more control. It helps us save money. And I told Mr. Malik, I saved you $42,000 a year. We saved you $42,000 a year. Well, you gotta say these things, and I don't say it in an aggressive way, or I don't, show up in an aggressive way, but just very calmly and politely, but I just make it the point for the nurses. And that's the kind of a thing, we never argue, we never fight, but just easily, put yourself up to where you belong and, very assertively and very kindly, just push your agenda forward, not for yourself, but for the profession.
If I were 20 years younger, I would really go into policy making because that's where the big change happens. I admire those leaders before us who did the research, who found out that we should have safe staffing ratio. I admire the nurses that says we need to advance the nursing education. So yeah, if I had 20 more years, I would be in policy making.
I think for me, whoever is aspiring for a leadership position, my advice would be HPPP. This is the acronym, and I will say it. Humility, patience, perseverance, and persistence. Thank you.
Thank you very much, nurse leaders. We really enjoyed this panel, and I'm sure everybody else did. With this, we conclude our day. It was a very nice day and successful. Continue tomorrow, inshallah.
Thank you.
Actually, we had a conclusion.
We have a closure. Okay. And now,
can I answer to the question from our own perspectives as MCs? We're still are not the leaders, but at the beginning, when we said the introduction, we said some words that actually we believe these are the secrets of each leader we met or we have ever met. We said, Dina, just share with me. We said we cry, but we are courageous.
We make mistakes,
but we are intelligent.
We face challenges,
but we are persistent. So these are the secrets.
Stay persistent and stay proud and stay brave. This is how you will succeed.
Inshallah.
So now, while our first day is winding down, and after listening to all these successful stories and successful leaders, I want just to say a reminder to all the nurses out there that reflect all of this to yourself, get inspired by all what you heard, and believe in yourself that you can be the strongest, the greatest, the best, and start by today to push yourself towards your limit to achieve your goals, because we all are born as leaders. So keep this in your mind and work hard to achieve it. Thank you.
We are eagerly waiting to see all of you tomorrow to celebrate and recognize our outstanding role models in nursing community. So stay tuned for our Daisy ceremony tomorrow early morning. Keep the spirits high and prepare your clapping hands for everyone. See you tomorrow.
Yeah, see you tomorrow.
Have a good night.
And do not forget that you have to register for the 3 workshops for tomorrow. And now we have the Leaders Summit with Ms. Hera.
Thank you, everyone. This has been a wonderful day. I know it went on a little bit longer than we expected, but you've been amazing. Our speakers have been amazing, and I thank every single one of you for making this day a success. Daisy breakfast tomorrow at 8 a.m. Don't forget, it's going to be a ceremony. And in the Nurse Leaders Summit now, we'll just maybe wrap up our recommendations from the day and finish this day. But the rest of you, we will see you tomorrow morning.